Good morning and welcome to the 32nd meeting of the Health, Social Care and Sport Committee in 2025. I've received apologies for today's meeting from Sandesh Gulhani, and Sue Webber is joining us as a substitute. Our first agenda item today is to take evidence from a panel of stakeholders on the Food Promotion and Placement Scotland Regulations 2025. And I welcome to the committee Professor Alexandra Johnson, nutrition scientist at the Rowett Institute, University of Aberdeen, Ewan MacDonald-Russell, Deputy Head of the Scottish Retail Consortium, and David McColgan, Chair of the Non-Communicable Diseases Alliance. And we'll move straight to questions. And Emma Harper.
Thanks, Convener. Good morning to you all. So I get to go first this morning. I'm interested in your thoughts about the fact that these restrictions on promotions and placement of certain foods, they're not presented in primary legislation, so we're doing this by further regulation and then guidelines. So I'd be interested in your thoughts about that.
Thank you. Can I start? That's a good question. So I think we need to think about why do we have the regulations, and that's because we know that 2/3 of the Scottish population are overweight and about 1/3 are classified as living with obesity. So we know that the food environment has a major influence on a healthy weight, and that's why we have these regulations coming into force to try and change the food environment so that it makes it easier to have a healthy and environmentally sustainable eating habits. But you know that also obesity is not equitable. I know that's a topic that will come up again later, and that we have higher rates of obesity in the most deprived areas, and particularly in females. So instead of thinking of this as a sort of nanny state approach, really it's a way to taking away the blame and the responsibility from individuals to try and change our food environment in Scotland. Thanks.
I'm happy to come in. I think normally I would have concerns about this through kind of secondary and through a negative instrument. I think normally when we would make regulatory changes, we broadly think that there's merit in this actually having the opportunity to be looked at detail. I think this is unusual, and I think we'd probably consider this to be a bit of an exception because the way the regulations have been drafted is relatively straightforward. For most of our members, they have implemented these elsewhere, or there's clear practice in how to implement these regulations. They should be relatively straightforward to implement, and the benefit of doing it through secondary legislation is it can happen a lot more quickly. I think we've been talking about this for some time. I think the retail industry is supportive of it being brought in next October. That will be about 10 months from it passing through Parliament potentially, which is very, very tight. We normally would want longer to implement policy. But in this instance, after a lot of discussion, I think we'd quite like to get on with it. So in this unusual instance, we'd support it. In other occasions, I might give a different answer there.
I think the view of NCD Alliance Scotland and our members is pretty similar, to be honest. We've been talking about this since 2017, 2018. The policy intent has been slowly shaved over the years, and I think there's probably a PhD in commercial influence on public health policy here. So from an Alliance point of view, we just want to see it done, if I'm honest, and I think bringing it through in its current state is better than holding out and waiting to see it watered down even more through further consultation.
And you mentioned, Professor Alex, that shame, and part of the work that I've done is looking at stigma and shaming people who are overweight and them feeling as if they're blamed for it. Can you speak a wee bit more about that?
Yes, I mean, that's incredibly important. So there are many reasons why people gain weight, and the food environment has such an important role in that. And I particularly want to highlight that as this regulation is around the retail food environment, about product placement and the way that food is sold to citizens in Scotland, we know that particularly shoppers with children and those that experience food insecurity are more susceptible to these product placements and price promotions that we see in the retail food environment. And therefore, these types of strategies are particularly important to target those types of consumers that are facing food poverty and low income?
Yes.
Yeah, if I can just comment. I mean, stigma and individual responsibility has been the narrative of industry since the tobacco industry were doing it in the 50s and 60s, and the food industry and the alcohol industry and the gambling industry are copying the tobacco tactics. I think what this legislation does is it lays bare the role that commercial interests have in influencing people's habits. So producers use temporary price reduction, for example, to increase their brand share. They don't do it to make it cheaper for people to purchase food. So I think just echoing, this is about laying bare responsibility on commercial actors for the actions that they take that influence everyday decisions that we make as citizens in Scotland.
And you mentioned the commercial. I was going to come back on that. This policy has already been implemented in England, and it's soon to be implemented in Wales, I think, as well. Is there differences in Scotland in what's been proposed compared to England? And with the commercial aspect of it, I think there is some issues that have come up around the influence of the big food giants in basically determining what products we see and are promoted, and even the influence of policy makers, because there's a whole food system that needs to be tackled, and this is only part of that.
Yeah, I mean, so just picking up on the influence of industry, for every public health lobbyist out there, there'll be tenfold in industry, and that's the reality, and that's the world we operate in, and they have a role within their organisation to do what they see fit. But I suppose the challenge here is looking at where the public good lies. What are we doing for the benefit of people in Scotland? So we are at NCD Alliance Scotland. We use the World Health Organisation's Big Bangs, which is looking at marketing, availability and price and promotion. So a number of those things are included within here, looking at the food and regulatory industry. So I think for us it is about looking at that commercial actor, how they operate, whether it's a multinational or national organisation, and creating a food system. And this is only a small part of it. This isn't the silver bullet. It's a small part of the food system that we operate in, to create an environment that is more conducive to healthy choices for people in Scotland.
Okay, I think that's okay for now. Thanks.
Brian Whittle.
Thank you, Convener. Good morning to the panel. I'll start with an easy one, or it's an easy one to ask. How do you think these regulations are going to support population health?
Maybe I can start with that. So as a researcher, I have already conducted a robust evaluation of the effectiveness of the regulations in England. So just a reminder that in 2022, the policy came about and they split the development of the legislation. So 2022, they introduced location restrictions in store. And then in 2025, in the 1st of October, they introduced the volume restrictions that we call in slang the bog off offers, buy one, get one free. So the research that I've been doing, funded by the UKRI, has involved obtaining data from 4 major retailers, and that's Asda, Morrisons, Sainsbury's and Tesco. And it's very much a big data approach. So I want to give you the scope of that. So we looked at 480 stores across Scotland, Wales and England, and that was 11.6 billion items sold and 6.8 billion kilograms of food sold. So it was a huge spreadsheet. And we could confirm that the magnitude of effect was that for the products that were in scope, and that's the high fat, sugar and salt, we could see that looking at the 18 months pre-regulation and then 12 months post-regulation in England, was that we can see that there was 2 million fewer items sold per day. And we can know that that means there's a reduction in 220,000 tonnes of food. So this is the first study to independently evaluate the effectiveness and the equitability of this HFSS legislation on the impact on supermarket sales data in the UK. Now, your question referred to how does it impact on population health. So we do have the Scotland's Population Health Framework, which was announced in June earlier this year. And this legislation, these regulations very much fit in because the scope there is to think about preventative strategies, which this is, thinking about access, which this thinks about access to healthier foods. It's person-led, and it's thinking about less so as the Population Health Framework thinks about quality of healthcare. So the Population Health Framework particularly mentions reducing the stigma around individuals living with obesity. They particularly mention improving the retail food environment. And then the last one I want to touch on is they are embracing reformulating foods to reduce the levels of fat, sugar and salt. So I think this regulations very much embrace this ethos around producing a healthier population in Scotland.
Okay, I want to dig into this a bit because actually this has been around since 2011. Christie report actually, it's hardly groundbreaking to say that if our diet falls in, or continues to fall into sort of ultra processed food, high sugar, high salt, that we will be unhealthy or unhealthier. It's hardly groundbreaking. I think my concern here is that, and I would seek your opinion on this to the panel, is that we seem to be looking at how do we prevent people that are accessing that ultra high processed food, rather than how do we promote better diets, how do we promote being physically active, especially in youth, how do we encourage a healthier lifestyle. It's all about banning stuff. Where's the balance in this? I absolutely agree with the prevention of marketing, but where's the balance to this in all of this legislation?
If you spoke to consumers and indeed retailers, then the balance in my experience has to be that we need further regulation to subsidise healthy products. So I agree with you that your comment that this regulation is about restriction of unhealthy products. The balance to that would be, and this is what consumers are looking for, is thinking about how do we make healthier foods lower cost. And that's particularly important, again, for those that are facing food insecurity and food poverty, because those are the consumers that are attracted by meal deals and offers which are often on those products that are high in fat, sugar and salt. With all due respect, the regulations are not on ultra-processed foods. We don't have any regulations in the UK around processing or ultra-processed food yet. And it's actually quite difficult. If you go into store and I asked you to identify which products are high fat, sugar and salt, it's not aligned to the traffic light labelling that's in the front of pack. You've got to use something called the nutrient profiling model, which is actually quite confusing. I would find it difficult as an expert in nutrition to truly identify those products. So if it's confusing for me, it would be confusing for other consumers that are less educated in nutrition. So, thank you.
I'm so glad you mentioned nutrient profiling models first, so I don't have to try and explain it, because it's a myriad of complexity. We've done guidance to help members with it, because it is very thing. The one thing I would agree with, obviously, with all of that is that this does create an incentive in the supply chain around how businesses are operating, because ultimately you don't want to be within these restrictions if you're marginal. Some products are always going to be within this. If you're selling a bag of crisps or a chocolate bar, you can't really make them non-HFSS, and that's fine. But there's a lot of products actually which can end up a little bit more marginal, and reformulation can give them an opportunity to get out of this space. And that's something I think that's really interesting when we look at the way that we set up incentives in this. Is there's stuff to ban because government decides to do so. There's also areas where we want to nudge businesses to remove the unhealthy and problematic elements of products in order to let consumers basically make healthy choices by stealth. Reformulation's been really successful. I think when this sort of policy making's done cleverly, it can help on the margins encourage people across the supply chain, retailers, producers, etc., to do that as well. So there just is one slight bit on that food environment. The only final bit I'd say is that some of this isn't mutually exclusive. We can put restrictions on stuff that has explicit health harms. That doesn't stop healthy kind of campaigns, promotions. Retailers do some of that, government does some of that, Food Standards Scotland do some of that. There's probably more that can be done by collectives, particularly by public and state bodies in that space, but it's not exclusive from getting rid of some of the difficult bits too. I'm aware I'm making the pro-regulation argument here, and I'm actually quite comfortable in this instance doing that.
And just before we bring you in, David, just layer, I mean, to your points there. If the labelling is confusing, why aren't we legislating on that to make it easier? Why are we focusing on calorific intake? Because that doesn't necessarily bring a healthier diet. Why aren't we looking at I keep saying this, being physically active, especially when they're young? Why aren't we looking at preventing people falling into the obesity trap in the first place? Regulation, I absolutely agree with this, but my concern is we've known this since 2011. It's hardly groundbreaking, and we're still not looking at how we help educate or put an education environment where people know what healthy food is. And why aren't we looking at if labelling's a problem? Why aren't we looking at that?
So I think education is key, so that we can inform consumers to make the correct choices. I think the area where the labelling is tricky is that the categorisation of high fat, sugar and salt, HFSS, you need to collect data from brands, and that means you need that retailers need to collect information from other companies like Brand Bank on the nutrition information on the brands that they're stocking. So the retailers don't necessarily have all that information to hand. So I think that's where we don't have a public database that we can all log in and check, and this makes enforcement tricky as well. The nutrition information which uses the nutrient profiling model of products that are being sold in the retail food space. So I think the reason why we're focusing on calories is, I'll give an example here. Nesta conducted a review and estimated that this legislation would, per person, impact on a 60 kilocalories per day reduction in energy intake, which could potentially lead to a 16% reduction in obesity. And that, for me, is one of the primary endpoints here, that yes, I accept we need a better diet quality, but we also need to help nudge consumers into consuming less calories, so that we've got a reduction in the public health crisis that we have in overweight and obesity.
Can I, just on that, you would also, if you went for an hour's walk, you would burn 600 calories. Why aren't we doing both of those?
I think the two are not mutually exclusive. I think we need a environment that encourages green space, encourages thinking about transport, and that's where the whole food system becomes quite complicated, and that there's actually not one solution to solve the obesity epidemic. It's multiple solutions which will be addressed throughout the life course. So we haven't touched really much on children. I work mostly on adults, so the first 1,000 days is incredibly important. The school environment, the hospital environment, the work environment. So this particular discussion is around the retail food environment and the impact that has on consumers making healthy choices.
Okay, I know I haven't brought you in, David, but my problem is this: is outcomes is what's important here, and we are the most obese country in Europe, one of the most obese countries in the world. So we're not doing very well, both in terms of diet and in terms of being physically active. So it's all very well saying we're going to bring in this legislation, but surely the only measure is outcome, and and outcome tells us it's not working.
Yeah, I would just echo the study that was done by Nest. I mean, there's clear evidence back in what we're discussing here today that there will be a positive outcome on the back of it around obesity in Scotland. But I think there's no one that's involved in this debate who thinks when this is passed we can all just go and be happy with what's happening. I think there's a whole range of issues at hand. There's promotions that aren't even included within these regulations that we think should be included in the NCD Alliance, like meal deals and temporary price reductions. There is a major issue around physical inactivity and its contribution to health. We've had many discussions around it, and I suppose one of the challenges around physical inactivity, and you can argue this, I'm sure, that it's not commercially driven. What we're looking at is our retail food environment as being commercially manipulated, that influence people. So, for example, in a Obesity Action Scotland analysis, 43% of people said they were buying impulsively because of temporary price reductions. They were buying things they didn't need just because they were on offer. If we can start to change that environment, I think we start to see that calorific intake go down. And the big challenge, and this is something that we grapple with at the Alliance all the time, is the easy thing is to say to regulate the bad thing. The hard question is, how do we promote the healthy? And how do we make fruit and veg cheaper? How do we make it easier to access? There's communities in Scotland that can't access fresh fruit and veg easily. And I think you've got to look at how do we make that more readily available. So it's not just this is it and we're all done. I think what we're talking about today is a step forward, but it's a step on a long journey.
No, I do agree. I think it's ridiculous that if I buy a coffee and a sandwich, it costs me less money if I add a packet of crisps in. It's just absolute bonkers. I get, but just, I think where I'm coming from here. I mean, I support the regulation of this, but if I give an example of what Japan did to positively influence the food environment, it's they did this thing where at school every school has a nutritionist, and you're not allowed to eat anything in school that's not passed by a nutritionist as being extremely healthy. So they have 4% obesity, and it's this idea that if we really want to change the environment in which this is an issue, we're not Japan. But what that shows me is that if there's political will, if there is the political will, we can make significant changes to our communities. And that's that's what I'm pushing back here against. This is scratching around the edges. We are not making the big changes that we need to make to improve public health.
Do you think that the Good Food Nation plan will create opportunities for local authorities to bring in new measures that protect vulnerable groups in society, for example, in schools?
I think the school environment, the 1140 hours of school environment is absolutely the battleground we should be fighting in. Oh, sorry. Yeah. Sorry,
Joe Fitzpatrick.
Thanks very much. The area you've just been covering there towards the end, I think, is roughly the one I was wanting to move on to. Really, I was involved in this legislation back in 2018 when there was a major consultation, and David, I think you mentioned it feels like every time there's a consultation it's getting weakened and weakened. So this doesn't feel anything like as strong as the proposals we had back then. Are we still confident it is going to make a difference? It feels to me that it's better than nothing, but it's not nearly as far as we should be going, which I guess I'm agreeing with Brian Whittle's point there. But David?
I think better than nothing is probably the phrase we would use about it in the Alliance. I've been here many a time talking about this legislation. I mean, for example, the 600 calorie reduction per week from price promotion and marketing is Scottish Government data. But their own data also shows that if it only includes multi-buy promotions, that drops to 115. So we could talk about language and words being cut out of the legislation as it goes, but also its intent is being weakened as we go. And I think there's clear evidence around whether it's political will to stand up to industry or industry's power that we've cut back. I mean, we will see if we don't include meal deals and we don't include temporary price reductions, we'll see loopholes all over the place. Your 3 for 2s will suddenly just become, 30p off for the next 3 weeks, and it all equate to the same issue. There was also a huge discussion. I don't think it ever appeared in the first legislation, but around brand loyalty discounts. So we see them in most supermarkets now have brand loyalty cards, and when you go everywhere, you'll see the discounts. I mean, they're not included in that as well. So I think we're at a stage where the public health community want to see some action. It's a baby step, I think, from what we could have taken, which was a giant leap in 2017, 2018.
So I guess the point would be that for colleagues, I'm obviously not coming back this year, I'm not standing in the election, so colleagues who are coming back next year to look at how this legislation is working and see what more can be done. Ewan, you mentioned that maybe there's a lot of good practice out there. I think at the start there's a lot of, for a lot of parts of the retail industry, some of the things that are being proposed here are already happening, and there is really good practice. There's examples of supermarkets promoting those more healthy food, given deals for vegetables. How do we make that the norm? I mean, I think that the point about regulation is, I hope, to level up. So how is it that we need regulation for absolutely everything in order to encourage those retailers who are not following good practice to push?
Thank you. If it's okay, I'll also come back slightly on a couple of things David's mentioned. As the industry lobbyist in the room, I never realised I was so powerful. I guess the first thing I'd say is that this can be iterative. We support these regulations. We've done these regulations in other parts of the UK. That gets us to a baseline. It means by October next year, across the kind of 3 nations within Britain, we've all got the same approach. And for retailers of scale, and the majority of the retail industry whose supply chain will be similar, even for smaller ones, we're now working off that baseline. And then we could look at the next kind of thing. So we're not coming here saying we should never have any regulation again. That's obviously not reasonable. The public health issues have been raised. They are real. This won't deal with every public health issue, but it is a good starting point. It's also regulation we can do quickly. So we're supportive of that, and we're happy to continue the discussion. To come on to the point about meal deals, the government's proposals on meal deals, I think were meant to aim at lunchtime volume multi-buy sandwich deals. That's one type of promotion. The way it was framed covered a whole gamut of different things, which everything from a volume promotion of things in the freezer area. It could cover a dessert deal. It could cover a barbecue deal. Some of these deals are high fat, salt and sugar. Some are not. And actually, once we dug into it, one of our members went away and dug properly into it. We reckoned that they stopped when they got to 3 million combinations of items. So it doesn't mean we can't do it, but it is a very complicated and complex thing to do. If we'd included meal deals in this, we need a definition that's not legally defined at the moment. This stuff all takes time. It doesn't mean we can't be doing that. I would imagine government officials will be working on what some of that might actually look like. I hope they are. But actually, the how of this is quite difficult, even if you accept it's a good idea or not. We would probably have different views. Our members have very broad views. We probably don't have a coherent view because some members would be commercially advantaged if that regulation did come forward because they don't offer those deals or they offer them in a way that would be less effective. Some retailers would lose part of their business because they would only do a lunchtime meal deal. So there's just a complexity to that which probably deserves examination. It certainly doesn't. And that's why when we spoke about this not being, the secondary legislation not always being appropriate, that's probably a good example where you'd need quite a lot of input. And I can only speak for the retail part, not the follow-on thing. The second point I'd say on multi-buy, this only refers obviously to pre-packaged food. So we're not talking about fresh food, we're not talking about food that's been made at a certain point. And that does impact on this as well. So we're talking about the food environment. This addresses one quite narrow area. It's the easiest area to do, but absolutely, there is a way that this can push. The third point is about the scope of the regulations. The regulations apply to shops over 185 square metres, 2,000 square feet, or those that have more than 50 employees involved. So there's actually a chunk of businesses who will be unaffected by these regulations. Some of those businesses are responsible retailers who will probably have enacted them similarly. In the same way lots of retailers haven't done bog-off deals for years, some of them won't. Some of those businesses who will be based in the communities which probably have the most need for these will be unaffected because government and Parliament has broadly taken a view that the onerous burden of implementation shouldn't be applied to the smallest businesses. But not taking a level playing field approach has a public health impact too, and that's a consideration that's not always perhaps made. Again, there are businesses which aren't retail businesses selling food who will impact on that environment as well. We represent some of them as well, so we're in it. Final bit on temporary price reductions. We philosophically think temporary price reductions are good. They encourage competition. They encourage competition between brands. They encourage competition between retailers. In our view, that keeps prices down. We think keeping prices down for customers is good. We think competition between retailers keeps prices down across the market. And I would note, just finally, a little bit on that food environment, that if you want to look at price... Sorry, I beg your pardon. There were quite a lot of points come up earlier. And so that final bit I would say is that there's huge price competition in healthy product and healthy food as well. And if you want to try and buy vegetables at Christmas, you'll find out exactly how acute that competition is. Sorry, Billy.
Can I just remind members that this session finishes at 10 o'clock and we still have 4 members who have substantial amounts of questions to ask. So can we be concise in our questions and also in our answers, please? Sue Webber.
This is a question, I suppose, to David and to yourself, Professor. You've spoken a lot about obesity and the retail environment, and I was wondering if you were perhaps a little bit disappointed that maybe these Just Eat and Deliveroo bikes and how accessible some of this food is to be delivered to people's homes wasn't in scope of this, and how that might make a positive impact in what you're trying to achieve.
Yeah, I think just really briefly, I mean, this is an area we grapple with really extensively, especially online delivery and around both high-fat, salt and sugar food and alcohol as well as a major issue. As one of these emerging areas, I think we're looking at it. I think probably we would probably have to go into a 5th and 6th consultation to see it included in here. So I welcome Ewan's remarks about, this is something that might be iterative and come further down the line. But I do think there would be it's something that really needs to be considered about how easy it is to access it without even moving off your couch.
Indeed. Professor.
So Food Standards Scotland presented data recently to show that the out-of-home environment has a hugely influential role on healthy weight and nutrition. And indeed, during COVID, we actually saw an increase in ordering through those online systems. So, and they have become more commonplace since COVID. So yes, I agree, we need further consultation, using a whole systems approach, using an evidence-based approach to think about how can we manage this sort of, I call, novel and evolving way of ordering food, and thinking about how they also advertise food, because that's often targeted at, for example, young people. So,
thank you. That's the convener.
Thank you, convener. Good morning to witnesses. Do you think the Scottish Government's assessment of health benefits of 2 to 2.4 billion over 25 years is realistic?
I mean, the assessments are, I suppose, modelled and looked at, so they're always open to interpretation. I mean, I think we know the scale of the challenge around obesity, the contribution it makes to heart disease, cancer, stroke, diabetes and other non-communicable disease. I think, I suppose we could look at the pounds and the pence, but we can also look at the human factor. And I think for us, we know that the vast majority of non-communicable disease can be prevented. We know that obesity is probably the largest area, or growing area, I should say, around contributing to NCD. So I think the intent of the policy is right. I think the outcome and the expense at the other side will be debatable. I always remember Sir Harry Burns once said to me, "Don't tell me you'll save the NHS money, tell me the difference you'll make in people's lives." And I think that's, for me, when it comes to this piece of legislation, it is about that environment that people will exist in and the impact that will have on lives thereafter.
Given the experience of using the guidance accompanying the regulations in England, what, if any, changes should be considered for the guidance procedure for these regulations?
to start on that one. The guidance process for doing this in England was lengthy and rather painful. I think the guidance is imperfect, but probably the working version we have is quite good. I think the 2 points that I would make around it. One, in Scotland, I'm concerned because we don't have a devolved primary authority model, so that means there is a risk that different local authorities might take different views on how the policy is interacted. We haven't spoken about enforcement. Enforcing this is, to be honest, barely happened in England because it's very, very complex to do. So from a guidance perspective, I think the Scott Working Group, we're on that. There's a second question, I believe, about how symbol groups and how retailers who are part or whether they are or are not part of franchises. That's a question in England that I think the legislation broadly bodged. I think the bodge meant that different organisations took different views on that. I think that might be a sensible approach. I think that if government tries to rewrite that, the odds are it's going to have lots of different impacts on it. But they're the two particular bits. But I would say that we did pretty significant guidance on the products in scope. And the very final bit is, please, can we not change the nutrient profiling model till at least we've got this up and running, because that's a huge amount of work to get that going to.
Just to comment on further that the research that I've done, and I'd like to submit this in written evidence, from the FIO Food Project, Food Insecurity and Obesity, and DIO Food Project, Dietary Health and Inequalities, the retailers that we spoke to based in England did interpret the regulation not to the letter of the law, shall we say. So we've seen evidence that the high-profile end-of-aisle area was used in England for exempt products such as baby food and alcohol, which is not that is not the ethos that we're trying to promote here. They use digital and print advertising, for example, stickers on the floor in that area. We know that the food to go was moved to other areas of the store away from the front area, which is the prime area, and that seasonal lines were moved into one aisle rather than the front of store or on pallets. And then last but not least, we know that some stores even went to change their store layout to shrink the size, that their total store area was less than the legislative cut-off, and they built bigger in-aisle promotion spaces. So yes, so the spirit of the regulation may not be upheld, and that at the end of the day, retailers are there to make a profit, and that there are other ways to promote these type of in-scope products in store.
My last question is aimed at you. The Scottish Government undertook extensive financial and business modelling in relation to impact on businesses. Do their assumptions, modelling and predictions match those of industry, presuming businesses have conducted their own?
So I guess they seem probably about right, I would say, for this. It's quite difficult because bringing this into Scotland is almost, it's just the thin bit of the iceberg that we need to worry about on this, the changes around in store and how to do that. So it feels like it's not particularly onerous per business would be kind of our assumption. There are caveats to that. There's obviously assumptions for businesses who have not had to do this before, who will be affected. That won't affect retailers of scale, but if you're a kind of smaller retailer, then you may not have kind of gone through this. So that would be my one question. We certainly know the hard part of this, the bit that was incredibly difficult, was product identification, which products were in and out of scope. That shouldn't be an issue, and that's why we're quite confident this can be done within effectively 10 months. It'll be a year since the announcement. But yes, it feels about right, but I don't have definitive data to confirm it.
No further questions.
Patrick Harvey.
Thanks very much. Good morning, everyone. I want to come on to enforcement. Obviously, the ideal would be if enforcement isn't necessary and there is just compliance, not only with the letter but also with the spirit, as we've heard, isn't happening down south. But if enforcement is necessary, I'm curious about your attitude to whether the penalties included are going to be adequate, whether local authorities will find that the fines that roll in are enough to pay for regulation, or if this is going to take additional resource for local authorities to apply it. And if I can start with Professor Johnson, because you talked about your work in studying the impact of this down south, are the big retailers simply rolling this out at a policy-wide level? So is the regulation in England already having an effect on their behaviour in Scotland? Or are they just doing whatever's allowed within the law in the different jurisdictions?
Thank you. That's an excellent question. And the answer to that is yes. We can see that the legislation in England is already actually having an impact in Scotland. And we can see that the in-scope products have already decreased as a result. And that's understandable that these retailers, if they're instigating reformulation of products, those products are not just held within England, they're rolled out across all stores. I want to come back to evaluation and the work that we've done with the Institute of Grocery Distribution. They are not aware of any enforcement or any fines for any retailers in England.
None at all?
None. So I think enforcement is incredibly hard. If you think about there is no sort of portal or app that the enforcement officers can use to make that assessment whether a product is in scope or out of scope.
So you're saying that, now, reading between the lines, it sounds as though you're saying that we cannot know if the rules are actually being broken, rather than we're seeing voluntary compliance to a level where fines are not necessary.
Yes. So the retailers coined the phrase, it was a force for good, but there's a number of loopholes. Yes.
Okay, I think that leaves me turning to you then, Mr MacDonald-Russell.
Firstly, I'm going to agree with all of that. That's our experience. I mean, we've said little to no enforcement in our regulations purely because it's possible there has been. We don't have any experience of it. I would say that from a Scottish perspective, this is a wider issue than just these regulations. We already see there's a problem with local authorities, for good reasons of resource, of course, but not enforcing a large amount of regulations. My small format retailers complain about the disposable vapes ban being de facto not enforced, a large number of retailers selling these. And that creates a pernicious environment in which responsible retailers who follow the regulations are de facto disadvantaged. So I think we are relatively comfortable with the kind of criteria on that, but we do think that enforcement's needed, and that needs resourcing. It needs the technical resourcing that Professor Johnson spoke about there, that understanding which products are where, how things should be laid out. And on top of that, it also needs there actually needs to be enough people to do this. Trading standards will need training and support. That's something we need in these regs. It's something I think this Parliament, I hope, will push government to do more of across all regulation, because regulatory burden is one thing. If it's not enforced, it's just disadvantaging responsible businesses.
So how much of the responsibility for enforcement lies with the industry then?
I think so. Firstly, retailers should be following these regulations. They're in law. They absolutely should be doing it. If they're not doing it, I hope they don't expect me to defend them for it. Retailers of scale will do this. There will be mistakes because these are complex. There will be some retailers who will find gaps within it because they want to push that. You'll have heard there that some retailers have introduced it in Scotland. Some haven't because they see a commercial advantage in not doing it. That's a market decision. So that's why you need that two-tier of one, retailers probably should do it. A lot of retailers will do it for brand reasons, for consumer reasons, because they want to be seen as doing the right thing. Others do need enforcement to make sure they do it. And that's probably as big an issue with small independent retailers as retailers of scale, I would say.
But leaving it to individual businesses to decide the extent of their compliance and how they're going to enforce it within their own business isn't adequate, is it? What responsibility would your organisation, for example, have in identifying the extent to which the industry as a whole is complying, providing that information, making sure that they know they're in the wrong when they've not complied?
Well, in Scotland, there's only 2 of us, so there's only a finite amount of shops we're able to check ourselves. We provide guidance and support. We try and bring members together. We'll bring them together with government, with enforcement agencies, with regulators to discuss that, to make sure we're briefing them. We will give them the information. We're not able to take any kind of role beyond that. But I kind of agree with where you're coming at here, that actually regulation that is unenforced is not regulation that will be effective. And we want Parliament to produce good law. We want it to be enforced properly. That creates a level playing field that advantages responsible retailers. That's what we would support.
I'll probably raise it with the Minister, how we ensure that the cost of regulation falls on the industry being regulated as a principle. If I could move on to talk about how we might expect this to work alongside the other aspects of how the industry is regulated. Is there a way that we can improve compliance with this by aligning other aspects of what local authorities do to regulate the industry, whether that's around environmental standards, other aspects that they already have as a responsibility? Can we get more effective kind of bang for the buck, if you like, in terms of the resources that local authorities do have to make sure that we achieve compliance in a more coherent way.
Yeah, I think just to echo Ewan's point, I think one of the biggest challenges for years within public health policy has been the lack of discussion around resourcing for enforcement. So we obviously speak to colleagues around alcohol, tobacco, vaping, and increasingly the food environment. And I do feel like we're just piling more onto the back of the same person, and it becomes a major challenge. So I think I'd welcome an open conversation, whether it's here within the Parliament or across government, about what is the landscape for our trade and standards, environmental health colleagues. I know there's major workforce issues in terms of the number of officers who are coming of retirement age and those coming into the industry. So I think there's a wider conversation to be had here. And just to echo Ewan's point, I mean, regulation without enforcement is really just setting up for it to fail. So I think a serious conversation on enforcement would be welcomed by everyone.
Grand. And last question, you've already mentioned on a couple of occasions to other members the concerns you've got about the narrow scope, the aspects which are not included. Why do you think that's the case? What's the rationale from the government's point of view? Are they simply taking the path of least resistance, or do you think there's some other reason why they decided actually this is the right approach?
I mean, I think given the weight of evidence on the potential impact of actions around price and promotion on high-fat, salt and sugar food, the only logical conclusion you could come to is that they just want to get this over the line. And it is the path of least resistance. You know, I think if you went back and looked over consultation responses, there's huge resistance around temporary price reductions. Yes. There's huge resistance around meal deals. I mean, Ewan narrated it really well, but that's an industry narrative around meal deals. Oh, it's difficult to define. We need to do this, we need to do that. The truth is, if there's a political will, and the best example to use is banning smoking in public places or minimum unit pricing. Industry told us the world would end if we did those. And there's a playbook that industry uses and they share it around. And I think we need to be aware that this is a piece of public health legislation. My question would be, why would the turkey vote for Christmas if you asked them that what was going to impact in their pocket? And for us, it's health over wealth. For others, it's the other way around. And I think you could go back, and that's why I say there's a PhD in this. You can absolutely go through this and look at it. And I think that's a challenge for everyone in Scotland. Now, industry absolutely have to be involved in conversations and around implementation, around delivery of policy. But if we as a citizen body say that we want to prioritise public health, that has to be the priority when it comes to legislation like this.
So you think, I will come back to you. I don't want to be, very briefly, I don't want to be personally unpleasant about it at all, but I think from what you're saying, you think we should be more comfortable if the industry representative here was less comfortable with this degree of regulation.
Yeah, and you and I were having a conversation on the way in here about a meeting that we both ended up in that was largely uncomfortable. Okay. But we're all grown-ups, and look, Scotland's democracy. Everyone's got a right to say what they want to say and input into it. And when policy goes through the meat machine, it comes out in a certain way. Yeah. We're not happy the way it's come out this time, but that doesn't mean we won't give up. But I do think there is and NCD Alliance Scotland has a very strong action on our hands around tackling conflict of interest and public health policy.
Yeah. So shouldn't the Scottish Government be making you a bit less happy?
I'm very happy with the Scottish Government making me happy on this occasion. It's unusual. Very briefly, I would say we would simply argue for public health impact to be proportional, so they balance the cost to industry versus the public health benefit, erring on the public health side. And secondly, just a slight correction. Since I've been in post with the SRC, which was since 2016, we've actually been comfortable and supported minimum unit price of alcohol. It's actually a good example of a public policy intervention that is proportional. Sorry, just to want to be accurate on that.
Okay. Thank you, Convener.
And thank you for being brief. Elena Whittam.
Thanks very much, Convener, and good morning to yourselves. I want to spend a wee bit of time, because I know we just have a small amount of time this morning. These regulations are quite narrow, and they're really seeking just to impact on one part of the commercial determinants of health. But I'm really interested in understanding how that's actually going to impact on the social determinants of health. I'm really interested in the impact both in a positive but also any potential negative impacts that we could see in terms of health inequalities. And I was wondering if the panel could speak to that. So maybe start with yourself, David. How do you feel as if it's going to impact on health inequalities?
So we know that obesity is disproportionately represented in our most deprived communities. So we are, by taking a regulatory approach and an environment approach, it's about changing the environment that people live and operate in. One of our concerns, however, around the legislation is specifically relating to companies with less than 50 employees and the floor size that is exempt, because these traditionally are the stores that are accessible by people who live in most deprived communities. So by taking this decision, I think there is a risk that we create a gap within, or a widening gap within health inequalities relating to obesity. It's something we raised in our consultation, we raised it in evidence to the committee. That would be something that we would encourage the government to have a look at again.
I mean, I think that's quite an important thing to get down on record this morning, because you alluded earlier to the fact that we do have places which are fresh food and indeed food deserts in some of our communities, and that is not just in urban settings, that could be in rural settings as well, where people don't have access to the fresh healthy food. So even if they had the skills and the knowledge and the ability to cook them and know what to do with them, they maybe wouldn't have access to them. So is that a real concern for the Alliance, that there actually might be some health inequalities that are slightly exacerbated if we don't actually work on the rest of the food environment that people are living in?
Yeah, so absolutely. For us, this piece of legislation is a very small slither. It was probably bigger when it was first proposed. And I think we need to accept, if it goes through as it is, that's fine, but it's not the end of the conversation. The food environment has major challenges, whether it's around transport, access, even in terms of market and availability. We know you're more likely to be marketed to if you live in a deprived community. So for us, it's a small part of the price and the promotion element. There's a huge part around availability, which is accessing the product, or over availability if it's high fat, salt and sugar food, and then also the marketing element. So it's a start. I think it's a wider conversation that needs to be had, and I think hopefully this is the kind of the icebreaker that leads to that wider food environment conversation in Scotland.
Thank you. And Professor Johnson, I'm wondering whether I can ask you as well, in terms of looking at individuals who perhaps have some health issues, some disabilities. Is there any concern that this could have a positive impact, but maybe even a negative impact, if we think of individuals who are perhaps neurodivergent, who have associated health issues like avoidant restrictive food intake disorder, who might be reliant on foods that actually do come under, I can't never get it right, HFSS guidance, and would be subjected to that. Is there any concern in that space?
I'm sorry, I don't have any data on that particular group of people, but I can address the wider issue of whether the legislation is equitable, because the last thing we want to do is introduce regulations that increase these dietary health inequalities, which may include the groups that you've mentioned there. So have actually done work on that, looking at the transaction data across England and Scotland. And I'm really pleased to report that where there was an impact seen of a reduction in sales in the retailers, it was equitable across different areas of deprivation. So it means that all areas were affected equally. Now, you may argue that what you want the legislation to do is benefit some consumers more than others, but at least we're in a situation that these findings, and I can submit these in written form, are promising and demonstrate that the restricting of placement-based promotion of the less healthy foods can lead to a meaningful change in sales. We haven't done any research looking at specific consumer types beyond those living with food insecurity and obesity, and I would urge the ministers in this room to think about evidence-based decision-making. And my colleague David's already said a few times there's a PhD in this, so I'll volunteer. I'll lead that research for you so that we can actually make sure that the legislation will be equitable for all. Thank you.
Thanks. And finally, Ewan, from your perspective from industry, you know, I think we've just had it explained clearly in terms of that population health perspective on it. So zooming out and looking at a population health perspective and not maybe just individual groups of people. But I'm wondering what the industry themselves could actually do to support healthy options for those who are experiencing food insecurity and do find themselves in those food deserts, and perhaps being serviced by those shops, as narrated by David, who are the smaller ones who fall out of scope. What can industry do to support people to make best choices?
I'll answer incredibly briefly, which is firstly, regulation like this, which has a limited economic impact, means that jobs and shops and stores aren't particularly affected. There's not an impact on food prices. It makes trading more economically beneficial. More broadly, if we want to have more shops in communities, then there's a large number of financial levers. And I would say the way possibly to look at this is wider just than a health issue, is actually how does government fiscal policy align to incentivise investment in these communities, and can it offset potential health costs? That way businesses aren't losing out but are incentivised to do better things. Very short answer, sorry.
Thank you. That was a very short answer. Thank you. Convener.
Thank you. Can I thank the committee witnesses for their attendance this morning, and I'm going to briefly suspend to allow a changeover of witnesses. We'll continue our previous agenda item by taking oral evidence from the Minister for Public Health and Women's Health on the Food Promotion and Placement Scotland Regulations 2025. And I welcome to the committee Jenny Minto, Minister for Public and Women's Health, James Wilson, Population Health Strategy and Improvement, and Rosie McQueen, Solicitor, Scottish Government. And before we begin, I believe the Minister would like to make a brief opening statement.
Thank you, Convener. I'm delighted to be here to provide evidence in relation to the Food Promotion and Placement Scotland Regulations 2025, made on the 29th of October and laid before the Scottish Parliament on the 31st. The committee will be acutely aware that in Scotland we have an issue with high levels of overweight and obesity and poor diet, which cause and contribute to many health problems impacting on quality of life. With around 2/3 of adults living with overweight or obesity, addressing obesity is a public health priority to ensure Scotland is a place where we eat well and maintain a healthy weight. Restricting the promotion of less healthy food and drink is a population-level intervention and is expected to have a positive impact on public health across all population groups. The policy seeks to reduce the public health harms associated with the excess consumption of calories, fat, sugar and salt, including the risk of developing type 2 diabetes, various types of cancer and other conditions such as cardiovascular disease, as part of a wide-ranging suite of actions to support healthier diets and healthy weight. Regulations have been published alongside a full suite of impact assessments and have been developed with valuable input from a range of stakeholders, both in response to the 4 earlier public consultations and through targeted engagement with key groups. Regulations will make it easier for people to make healthier food choices by targeting food categories that are significant contributors of calories, fat and sugar to the Scottish diet and are the food categories of most concern to childhood obesity, as described in the UK-wide reformulation programmes. Restricting promotions of pre-packed food and drink products within targeted food categories that are HFSS, restricting certain price promotions to target HFSS foods such as multi-buy offers, for example, buy one, get one free, and free refills of soft drinks with added sugar, and restricting the placement of targeted HFSS foods in prominent locations in store and online. Regulations align with equivalent policy in England and Wales and will come into force on the 1st of October 2026, ensuring businesses have sufficient time to prepare. However, it is important to note that no single intervention can turn the tide on Scotland's high levels of overweight and obesity. That is why the Scottish Government is taking a wide-ranging action to improve diet and support people to be healthy weight. These regulations form part of our longer-term whole-system approach to preventing high levels of overweight and obesity and poor diet, which cause and contribute to many health problems impacting on quality of life. Now, I'm sure the committee will agree that these regulations are the first of actions delivered under the Population Health Framework, are a key and necessary measure to improve the health of people in Scotland. Thank you.
Thank you, Minister. And we'll move straight to questions. And Emma Harper.
Thank you, Convener. Good morning, Minister, and good morning to your officials. I am interested in this legislation about high-fat sugar and salt and how maybe in the future it will link with ultra-high processed foods and how we deal with advertising and marketing and display as well. So I'm interested, Minister, is in the Government's rationale for bringing forward these measures in these regulations rather than primary legislation which was previously proposed. Is it that we'll be able to expedite this in a more timely manner, for instance?
I thank Emma Harper for her question and recognise the work that you do with regards to ultra-processed food. You're right. Initially, the Scottish Government thought that this would have to be brought in through primary legislation. However, work that has been done across the years has shown that regulations are the best way to do this. It will allow them to happen more quickly and to, I think, take a phrase from Ewan and David, your previous legislation, that we need to see it done. So that's why we're doing it through regulations.
Okay. And in terms of, I'm aware that England has introduced it already, Wales is about to, and I'm thinking about, I'm I'm conscious of the time, so I've set my timer, convener. How does it align with England, Wales and then EU, for instance? Is it very similar that's what's been proposed in Scotland?
Yes, it is the short answer. We did a lot of evaluation and also took a lot of consultation, and it was felt that the appropriate way to follow this was, like the Welsh have done, introduce the product placement regulations, but also the buy one get one free price promotions at the same time, and that's what we're introducing.
Okay, and basically product placement is part of it, and how will we measure whether this is working or not?
I think this is absolutely key to it, and you just took some evidence there about the importance of the work that the University of Leeds, for example, has done with regard to the implementation in England. What we are doing is we've asked Population Health Scotland Public Health Scotland to ensure that they are doing the right evaluation and also how this ties in with our population health framework as well.
Okay, thanks. I'll leave it there. Thanks.
Thank you, Ms Harper. Brian Whittle.
Thank you, Kavira. Good morning, Minister. You'll
Morning.
understand my interest in this particular topic. I think, my frustration is that we've known about this for a long time through the Christie report in 2011. Harry Burns has done a lot of really great work around this. And much as I welcome any move there is to tackle a huge issue in Scotland, we are unhealthiest, most obese country in Europe. Where much as we're trying to reduce and ban, if you like, the use of these unhealthy foods. Where's the work around promotion of healthy? Where's the work around, erosion of our opportunity, especially for our kids, to be physically active, which is a huge symbiotic, response to diet, especially around, preschool, 1140 hours, and into primary school, where we create all those habits. Where's all the work around that? Because in the end, it will take much more than this, and much greater political will to make the significant change we need to make.
Thank you. Thanks, Brian Whittle. This is a topic we have a lot of conversations about, and I'm very clear that I am very pleased that we are bringing in these regulations at this time. Do I think we can go further? Yes, I do. And that's work that we are continuing to do, certainly falling under two pieces one piece of legislation, so the Good Food Nation Act, but also the Population Health Framework. And I think you're right, there isn't just one size or one solution that will improve the health of people living in Scotland. It's got to be a much wider, rounded, whole person way. And just yesterday, I spent some time in Dunoon in my constituency with Argyll and Bute Youth Action Council, and we were talking about the importance of healthy food in their diet. We were talking about them having lessons as to how to cook soups that were healthy. So I think it's a whole thing, but we were also talking very much about the importance of activity as well, and recognising the importance of getting out in nature. In fact, a group from Helensburgh, they're not in my constituency, were in a group of young people that climbed to the top of Ben Nevis, and that gave them a lot of learning points. One from the exercise, also the importance of having good nutrition to keep energy levels up as they were climbing the hill, but importantly as well of teamwork and working together to improve their health and well-being.
That's great. Why are we reducing the opportunity for kids to do that then? We know what health is. We know how to be healthy. We know how to move about, eat better. Concern around the fact that this seems to be around calorific intake rather than what the makeup of those calories. But I hear this a lot, Minister, and I know you're passionate about this as well. I hear this a lot about what we could do, what is healthy, but how are we? Why are we reducing the opportunity for that to be universally accessible across our country?
So I've just given you an example of where that is happening across Argyll and Bute, and working to ensure that children get the right education, which I think is part of this.
Absolutely.
I've said on a number of occasions that I find this as one of the most difficult areas of my portfolio because I love food. And I was lucky to have an upbringing that explained the education side of things, which is why I'm passionate that we need to start looking at this from a whole environment perspective. So ensuring that when families go into the shops, they are seeing healthy food first. When they're paying for their shopping, they are not seeing the treats that might push them into a less healthier environment. And also I believe that these regulations, and you just took evidence there, that also talked about the pressure to spend more money on items that are high fat, salt, sugar because of the buy one, get one free offer. So what we're wanting to do with this legislation, and it is a nudge in that direction, to ensure that people are using their available budgets the best way to ensure that they get the healthier meals, the healthier food environment that then will hopefully allow them to being healthier. And with regards to sport and getting that on the agenda, I think last week's result against Denmark really has put sport front and centre. The curling that's going on just now in my own constituency, the World Stone Skimming Championships, there's a lot of sport going on that the Scottish Government is there to support as required.
Well, potentially then, if that's what sport's important, we need to stop cutting the sports budget and actually double the sports budget as was declared in the manifesto last time. But my final thing is...
Okay. David Torrance.
Thank you, Convener. Good morning, Minister and officials. Minister, what will be the financial impacts of the regulations, both in terms of cost and benefits to health?
So, when we submitted the regulations, we did a partial BRIA business impact, which set out any indications that we felt this could impact on consumers. They were minor, and I think that's important to recognise. And I think it was David McColgan talked about wealth and health, and vice versa, wealth and health. And I think where I'm very clear is that by bringing in these regulations, we are allowing people to make the right health choices that hopefully, according to the BRIA, will not impact too much on their budget. As I referenced to Mr Whittle, sometimes the buy one, get one free offer means that people are spending more of their resources in the high-fat, salt, sugar food as opposed to on healthier options.
The modelling used for health benefits has focused on calorie reduction. Is this an appropriate approach, and do you think it under or overestimates the health benefits of the regulations? These are conversations that I've had a lot of with officials and also the third sector organisations and public health areas and businesses. And my understanding is that most people recognise what calories are, and that's there on the product, so therefore they can make informed decisions on that. And again, there is evidence that we've received from Food Standards Scotland and also Public Health Scotland about the impact, and more widely through Nesta and Obesity Action Scotland, the impact of diets that are high in high-fat, salt, sugar content, and the impact that has on health outcomes, whether it be type 2 diabetes, cardiovascular, etc. No further questions.
Thank you. Patrick Harvey.
Thank you very much. Good morning, Minister. My sort of internal reg flag was already going up when I saw that the industry representative was entirely comfortable with this level of regulation, which leaves me worried that it's not going to be robust enough. And one of our witnesses this morning said that this is better than nothing, but that you're taking the path of least resistance, particularly in terms of the scope and the aspects of harmful activity which will not be covered. Why is that?
I hosted a number of roundtables when we were gathering evidence for these regulations to support the decisions that I finally made. And these roundtables included people from third sector organisations, non-communicable diseases, for example, also business and also health stakeholders such as Food Standards Scotland, Public Health Scotland. And I was very clear at the start of these that this had to be a whole system approach. We can't have a healthy Scotland without healthy people. We also can't have a healthy Scotland without healthy businesses. And we need healthy people to operate healthy businesses. So I believe that there's that circular requirement for everything to be ensured.
So within these roundtables, you would have heard people arguing that temporary price reductions, meal deals, freestanding displays and other aspects should be included, and you decided not to include them. Why is that?
So for a number of reasons, and you're right, yes, I did hear these explanations. So, for example, meal deals. Meal deals are more difficult to define. It's not just simply your sandwich, your fizzy drink and your crisps. I do recognise that it does seem strange that if you've got a meal deal and you get a free packet of crisps, that isn't the best thing to do, which is why we are continuing to explore these specific things under the Population Health Framework.
So the definition would take a bit longer. Does that mean you're going to do that as well? That is a commitment for the next session of Parliament? You're going to do this first and there will be more to come. Is that the government's position? So
I've been very clear that this has always been the first step in our area around the whole food environment regulations. As I've just said, we are considering this and taking evidence and exploring it under the Population Health Framework.
Okay, can I come on to enforcement? Obviously, the ideal would be that enforcement isn't necessary, where you get complete compliance, but the experience from England suggests that's not happening. And local authorities already have a significant burden of responsibility that they don't feel well enough resourced in terms of existing issues like food crime, environmental health and so on. Would you accept the principle that if an industry requires to be regulated, it should pay for the cost of regulation? And does local government have the tools to make sure that the activity of regulating generates enough income to pay for itself?
So enforcement is one of the areas that I think we have to get right, which is why we've pulled together a group that is looking at that. We work very closely with COSLA and the local authorities to ensure that they've got the right support to be able to do the enforcement.
So COSLA agree that they have enough support to...
So we're exploring to ensure that they do have the right support to enable them to focus on where they see the biggest risk as being.
I'm just trying to be very specific in a limited amount of time. You're saying you're working with COSLA and the intention is that they will be given enough resource to apply enforcement of these regulations and that COSLA will be satisfied with the amount of resource that they've got?
I think we have to be clear and understand the resource that COSLA believe they need.
We need to be clear and understand and provide it?
I can't comment on that just now. I accept where you're coming from, especially from the evidence that the Professor gave.
Okay, I am going to ask finally, I think I've got 2 minutes left if I'm timing myself correctly.
No, you
don't. Okay.
You're just about at 5 minutes. So
very last question then. How do you intend to measure and monitor the impact of the regulations? How will it be evaluated so that we know what needs to happen next?
So we've been very clear with Public Health Scotland that that is within their remit, and we're working with them to ensure that that evaluation is done. Because you're quite right, there's no point in bringing in regulations if we haven't got the evaluation to understand the differences that has made and allow us then to provide the evidence to take additional steps as required.
Thank you.
Thank you, Mr Harvey. Elena Whittam.
Thanks, Convener, and good morning, Minister. I want to spend a little bit of time, obviously we've only got a short 5 minutes, looking at the impact that these regulations could have on inequalities. And in the last session we heard from David from the NCD Alliance round about food deserts and the impact that the availability of fresh food can have on people who are experiencing inequalities. So I'm wondering if you can explain how the population health framework in particular, but also other food-related policy, will mitigate any potential skewing effects of the regulations on inequalities, because we know that if we think about minimum unit pricing itself, although it had that really good population effect, there could be an impact on at an individual level. So I wonder if you can respond to that.
Yeah, thank you for the question. And it's an area that when we were gathering evidence that I recognised it was important to get feedback from areas that are living with higher deprivation, for example. So we had 2 round tables with the Poverty Alliance just to understand how they felt that that could impact. And it comes back to what I was saying earlier about the whole environment that people are shopping in. And we need to look at how we reduce the poorer health outcomes of those in poverty. We did an equality impact assessment with alongside Fairer Scotland as well, to ensure that we were bringing in recommendations, regulations that didn't impact too negatively on people's available budgets, which I've spoken about. There was evidence given to us that buy one get one free resulted in people perhaps making unplanned purchases, which is why we wanted to review that area and bring in regulations like that. I think we've also got to recognise that the Scottish Government also does a lot out with these food regulations to address inequalities. £3 billion to tackle poverty, the 1,140 hours of childcare, free childcare, and also school meals, and also investing in community food networks as well, to ensure that people have access to high quality, healthy food. And as I touched on what I saw yesterday, which I've also seen in a number of food pantries, is that ability to show and educate people in how to cook healthier meals. So it's a whole system approach.
I think that the food pantry network and that access to community grocery stores, etc., is an area that we really should be supporting and helping to flourish. But I'm wondering if we think about those convenience stores that are in some of our remote areas, rural areas, and also in our population centres where we have a lot of deprivation. A lot of them are out with the scope of what these regulations are going to deliver. So I'm wondering how the government could support such retailers to actually offer healthier food to the individuals that they're serving.
So we do have a healthier food initiative through the Scottish Grocers Federation, which we've invested just over £300,000 in this year to help them promote healthier foods. I've been to primary schools in areas of higher deprivation where there is that explanation to bring in healthier food at breakfast time and breakfast clubs to support children to make the healthier options. So, as I say, it's a whole system approach to.
Okay, and finally, I'm wondering whether the government's going to monitor any impacts in terms of inequalities going forward, and we'll bring that back to Parliament to scrutinise, because I think it's really important that we understand how these regulations may impact positively or negatively on individuals who have disabilities and how they access food.
Yeah, I agree. And that's part of the work that I would be expecting Public Health Scotland to be doing as part of their evaluation.
Thank you.
Thank you. Thank you very much, Minister, to you and your officials. We'll continue on with our work, but if you wish to leave at this point, you're free to do so. The second item on our agenda today is consideration of 3 negative instruments. The first of these is the instrument on which we've just taken oral evidence. That's the Food Promotion and Placement Scotland Regulations 2025. As we heard earlier, the purpose of these regulations is to restrict the promotion and placement of targeted foods high in fat, sugar or salt, where they are sold to the public. The Delegated Powers and Law Reform Committee considered the instrument at its meeting on the 11th of November and made no recommendations in relation to the instrument. No motion to annul has so far been received in relation to the instrument. Do members have any comments? I propose that the committee does not make any recommendations in relation to this negative instrument. Does any member disagree with this? Thank you. The second instrument is Official Controls, Import of High-Risk Food and Feed of Non-Animal Origin, Amendment Scotland Regulations 2025. The purpose of this instrument is to amend Commission Implementation Regulation EU 2019/1793, imposing temporary increase of official controls and emergency measures governing the entry into the Union of certain goods from certain third countries. This will give legislative effect to the Minister's decision with respect to the outcome of a review of Regulation EU 2019/1793, which lays down the requirements that apply to certain high-risk food and feed commodities of non-animal origin on entry to Great Britain. The Delegated Powers and Law Reform Committee considered the instrument on the 18th of November and made no recommendations in relation to the instrument. No motion to annul has so far been received in relation to this instrument. Do members have any comments? I propose that the committee does not make any recommendations in relation to this negative instrument. Does any member disagree with this? The third instrument is the National Health Service Charges to Overseas Visitors Scotland Amendment Regulations 2025. The purpose of this instrument is to ensure overseas visitors who have been medically evacuated from Gaza for NHS treatment via the Gaza Medical Evacuation Scheme can receive relevant healthcare services provided by NHS Scotland at no charge. The Delegated Powers and Law Reform Committee considered the instrument on the 28th of October and made no recommendations in relation to the instrument. It did draw the instrument to the attention of Parliament under reporting ground JI, failure to lay the instrument in accordance with section 28 brackets 2 close brackets of the Interpretation and Legislative Reform Scotland Act 2010, but concluded that it was satisfied with the reasons given for the failure to comply with the laying regulations. No motion to annul has so far been received in relation to this instrument. Do members have any comments? I propose that the committee does not make any recommendations in relation to this negative instrument. Does any member disagree with this? I will now briefly suspend the meeting before we progress to the next agenda item. Our third agenda item today is Day 4 of Stage 2 proceedings on the Assisted Dying for Terminally Ill Adults Scotland Bill at Stage 2. Let me begin this item by formally welcoming to the meeting Liam McCarthy, member in charge of the bill, and a number of other members who have lodged amendments to the bill. Depending on the progress that we make this morning, the committee may continue its meeting from 6 p.m. this evening with a view to completing Stage 2 proceedings of the bill. As members will be aware, the debate on the group reviews and assessments, commencement and expiry of the Act was commenced but not concluded on Day 3 of Stage 2 proceedings. The debate on this group will now continue where it left off, with Liam MacArthur to speak as member in charge of the bill and Jackie Bailey to wind up.
Thank you, Convener. Can I also begin where I concluded last time round by reminding the committee of my declaration of interest and the support I get from Dignity and Dying, Friends at the End and Humanists Society Scotland. With regard to Jackie Bailey's amendments 54, 55, 57, 64 and 61, as a general point, I wish to express my support for any work undertaken to assess the status of palliative care, hospice and end-of-life services, and anything that seeks to support such services. With regard to the potential impact of the bill on palliative care, I refer again to the report on assisted dying published by the Commons Health and Social Care Committee just under 2 years ago, which concluded, and I quote, "In the evidence we received, we did not see any indications of palliative and end-of-life care deteriorating in quality or provision following the introduction of assisted dying. Indeed, the introduction of assisted dying has been linked with an improvement in palliative care in several jurisdictions." Amendment 54 requires Scottish ministers, as soon as reasonably practical after royal assent, to carry out an assessment of and publish a report on the likely impact of the provisions of the Act on hospices and providers of palliative and end-of-life care services. And Amendment 57 requires the review to set out the impact of the Act on hospices and palliative care providers. An assessment of the likely impact of the Act may be difficult at such an early stage, but from my own engagement with Hospice UK and Jackie Bailey, I understand and am sympathetic to Amendment 54. With regard to Amendment 57, as I say, I believe and evidence suggests the bill will not negatively impact upon palliative care, hospice and end-of-life services. However, the provision requiring a 5-year review of the operation of the Act is intended to deal specifically with the function of the Act, i.e. supporting terminally ill adults in being lawfully provided with assistance to end their own lives. The bill also provides that any concerns with the operation of the Act which have been raised must also be covered in the report alongside the Scottish Government's response to those. This would allow for any concerns about palliative care, hospice and end-of-life services in relation to the Act to be raised, reported on and a response provided. However, I am mindful that Amendment 57 would add to the review of the assisted dying legislation aspects which are not directly related to that legislation. Bringing in other matters may risk diluting the review process. I am also mindful that Amendments 54 and 57 duplicate each other to a certain extent. I note the Scottish Government's view that from a delivery perspective, it would be challenging to measure the impact of the Act on hospices and palliative care. This would be reliant on data from Public Health Scotland, which they do not currently collect in the necessary manner. Furthermore, the Scottish Government add that should any data collected show changes in relation to hospices and palliative care, it may not be possible to attribute these changes to the Act rather than other factors such as delivery of actions outlined in the new palliative care strategy delivery plan, an ageing population, changes in workforce, etc. Amendment 61, which seeks to prevent the substantive provisions of the Act being commenced by Scottish ministers until a report as outlined under Amendment 54 has been published, could delay implementation even though all necessary measures are otherwise in place and therefore prolong suffering of people with terminal illnesses who wish to access this choice. As I've said on some other similar amendments, the bill provides for Scottish ministers to commence the substantive parts of the bill by regulation. Scottish ministers will have the necessary oversight and I expect them to commence the various substantive parts of the Act only once all relevant health, social care, social work and other services are appropriately prepared and all necessary measures in place to allow assistance to be requested and provided in that way. Singling out in statute particular steps that must happen before the Act can be commenced risks undermining this process and further risks potentially delaying the availability of assistance for those that wish it. On that, yes, certainly will.
I thank the member for taking that intervention. Does the member recognise, too, though, that there is a risk if social care services are not in place that some people who rely on them, even before they have a terminal illness diagnosis, could feed the fact that they might find life very, very difficult and could actually be a factor in their decision making. Does the member not think it would be useful to make sure that these services were in place and up to capacity before the Act came into place?
I understand the point that Pam Duncan-Glancy is making, and it's why I'm supportive of those assessments being carried out. I think those assessments won't necessarily speak to the specific circumstances of any individual that's going through the process. And as I say, I think it's incumbent upon ministers to ensure that all the requisite steps have been taken in relation to health, social care, social work and other services being aligned to ensure that the provisions under this bill can be safely provided for and delivered. On that basis, I'm content to support Amendment 54 and consequential Amendment 64, but would urge the committee to resist 57 and 61. On Jackie Bailey's Amendment 55, as with 57, I note the Scottish Government makes some of the same points in relation to data gathering responsibilities and resource implications. I share those concerns and don't support the amendment. On Pam Duncan-Glancy's Amendment 258, consequential Amendment 280 and 284, while I'm fully supportive of anything that can assess and support the social care sector, I question whether this is best placed in my bill, which is the primary purpose of allowing mentally competent, terminally eligible adults in Scotland to voluntarily choose to be provided with assistance by health professionals to end their lives. Again, the Scottish Government identified the need for new processes and investment almost certainly better targeted elsewhere in supporting social care. With regard to Amendment 284, which would prevent the bill being commenced before an assessment of social care services had taken place, I refer members to the previous concerns on such provisions in the bill and the comments I've just made in response to Pam Duncan-Glancy's intervention. On Stuart Macmillan's Amendments 259, 281 and 285, if this bill is passed by this Parliament, after rigorous, thorough debate and amendment, which has been anything but rushed, I can't see the case for holding a costly and time-consuming referendum on the Act. As I recall, there was no call for such a referendum during Stage 1. It's not a feature of our legislative process and would, as I say, come at considerable cost, while also delaying the ability of those terminally ill adults who meet the criteria and wish to access the choice of an assisted death from doing so. If there's any consolation to Mr Macmillan, I would point him and members of the committee to the recent Spice briefing, which stated, and I quote, "Public opinion polls and surveys since 2005 have generally shown that a majority of adults in Scotland and the rest of the UK support a change in the law to allow assisted dying for someone who is terminally ill." Regarding Miles Briggs' Amendments 21, 22 and 23, the bill provides for the collecting and publishing of data. I believe it's crucial the assisted dying process is transparent, with relevant, anonymised data made publicly available. The data collected will help inform understanding about the impact and effect of the bill. Amendment 21 may aid transparency and provide useful information. However, both it and Amendment 22 appear not to link to the data collecting requirements under the bill, which provide that declarations, doctor's statements, cancellations in the final statement after a person's death are recorded in the adult's medical records. This is the information that is then drawn on by Public Health Scotland as per Section 24 for the purposes of the reporting provisions of the bill. I'm not opposed to Amendment 22, but note it may place added burdens on healthcare professionals to research for themselves, or even patients to assess what's available. There are some questions to consider here, such as how would quality be judged, how would the healthcare professionals investigate the distribution, perhaps medical records may be useful in providing some of that information. So while not opposed, I feel these amendments would benefit from further refinement ahead of Stage 3. Turning to Amendment 23, Section 27 of the bill provides that the Scottish Government must, as soon as reasonably practicable, after a review period, review and report upon the operation of the Act. This period is set at 5 years, beginning with the day on which Section 1 of the Act comes into force. Amendment 23 sets out that the report must include Scottish Ministers' assessment of matters relating to palliative care services as described. As I stated earlier, the bill provides for the collecting and publishing of data that is focused on the assisted dying process. This will assist Scottish ministers in assessing how the Act is operating. In terms of the last part of the amendment, it's not clear how the methodology would show a direct correlation, i.e. the impact of assisted dying on palliative care, given so many variables, a point that was also picked up. Yes, certainly, yes.
Thank you, Convener, and thank the member for taking the intervention. I've got some data here that showed that in New South Wales, they'd committed to spending an extra $743 million on palliative care over 5 years when the assisted dying was legalised. But in 2023, the decision was then reviewed and the palliative care budget was slashed to $249 million in a single year. So bearing that in mind, and some of the figures and the coverage we've had today about the pressures that our hospice services are in Scotland, can you not see that as a real risk to supporting the services and the expansion of palliative care that's very much needed right now?
No, I mean, I think Sue Webber raises a specific instance in New South Wales. I mean, I think the argument I've always made is that seldom is the increase in budget, were it to happen, a part of the legislation. It tends to come in a separate decision taken by government or taken by Parliament. I think what the debate around my bill is allowed to happen is more of a debate on palliative and hospice care, and I very much welcome that. I think ultimately any additional resource that is delivered to the sector will come through budgetary decisions by the Scottish Government and by this Parliament, and therefore I think for those of us that believe that additional resources are needed, we need to continue to make that case, and we can make it on a cross-party with a forthcoming election, I dare say it will feature fairly prominently in the manifestos of each party, but it will be delivered through a budgetary process rather than through the legislation. I think the point I was making and the conclusion that the Health and Social Care Committee in the House of Commons made, that is what they have seen is no evidence of a deterioration in delivery of palliative and hospice care, and in many instances an increase both in budget but also in terms of the quality of the engagement with palliative care, which this committee heard at stage 1 evidence as well. And I think that comes and arises from the processes that are put in place through those accessing assisted dying, who need to have discussions with the medical professionals about all of the options that are available to them. And I think too often palliative care is not necessarily understood as well as it might be. And you're wanting another intervention? Yeah. Okay.
Bearing in mind that the hospice budget, which delivers the majority of the palliative care, is not really funded by Scottish Government funding decisions, and nor was any assisted dying legislation on anyone's party manifesto. So there's a little bit of conflict arising there. Well,
I mean, and that's on us, Ms Webber. If we want to prioritise this, we have an election coming up with manifesto commitments that each of us can make. I think the point I was making was in response to your earlier point about a budget reduction in New South Wales, presumably from the government in New South Wales.
To the
I mean, I can respond to your questions, Ms Webber, or you can continue to intervene. The point I was making was that in response to your point about budget allocations in New South Wales, that was a government decision. Now, if there's a feeling that the hospice sector, or indeed palliative care more generally, is requiring more resources, then that's an argument that we can make. And as I say, I think what has been encouraging over the last 2 or 3 years is that not only has the profile gone up, but there has been more of a cross-party endeavour, both to highlight those issues and to press for additional resources. So, yeah, in terms of the last part of the amendment, it's not clear how the methodology would show a direct correlation, as I've said. So, sympathetic as I undoubtedly am to the arguments being put forward here, I'd ask members to reflect on the extent to which the bill is the most appropriate place for Amendment 23 and this sort of process. Certainly, the first 2 parts of the amendment seem distinct from the assisted dying process. On Daniel Johnson's amendments 18 and 19, I'm not opposed in principle, but would question how necessary such a commission is, given the provisions already in the bill and the level of SPCB resource and MSP capacity likely to be involved. The bill requires data gathering, reporting and review. There will be opportunities for Parliament to consider monitoring and scrutiny within existing structures, for example, by the relevant committee considering the annual reports or any other scrutiny of the Act it wishes to undertake at any point. As such, I don't believe a commission is necessary. I note too the drafting issues highlighted by the Scottish Government, not least in relation to the interaction with the Public Finance and Accountability Scotland Act 2000 and the Interpretation and Legislative Reform Scotland Act 2010. Similarly, Murdo Fraser's Amendment 199 is obviously well-intentioned, and the issue of how best to provide for proportionate oversight is one I gave lengthy consideration to ahead of introducing the bill. I'm not convinced, however, of the extent to which such an oversight body would provide additional safeguard, while also noting that it appears to overlap with the remit of the GMC. As with Daniel Johnston's amendments, I'd argue that the balance is always to ensure that safeguards do not simply act as an unnecessary obstacle while not providing any meaningful added protection. I'm also mindful that various amendments have been lodged proposing different models of oversight. In that context, I would reiterate what the bill provides for, but also what current processes exist that would ensure the Act can be safely and transparently implemented. I've previously referred to the Stage 1 evidence from the Crown Office and Fiscal Services Scottish Fatalities Investigation Unit. The bill also provides for the collection of data, publication of annual reports and for a 5-year review of the legislation as provided for in Amendment 199. Turning to Stephen Kerr's Amendment 129, which relates to his Amendment 126 debated earlier, previously, this would capture information relating to the time between a person using the substance and dying and any complications. Given Amendments 183 and 184 were passed last week in this regard, I'd expect these issues to be captured by those new provisions. Stephen Kerr's Amendments 201, 204, 205 and 206 would establish a rolling review period every 2 years. I consider allowing 5 years before a review of legislation strikes an appropriate balance that allows enough time for the assisted dying process to have been operating to gather meaningful data, identify trends and draw any conclusions or make recommendations if necessary. I certainly will.
The issue here, and I think you do appreciate this, is this law represents a fundamental change in the relationship between patients and doctors and patients and lots of other people that are there to help them. The start-up of this, should this pass into legislation, the start-up phase would naturally be a period of where we would be required, I think, as legislators, to take a very keen interest into actually how the law was working, the impact it was having on the very people that I do sincerely believe that you have at heart. So, at least in the initial phase of the enactment of the law, would it not be a good idea, with that close inspection in mind, to narrow the 5 years to 2, so that we are getting real-time information about what is really happening because of this law? Because at the moment, this is going to be an area where we've never gone before, obviously. Nowhere in the United Kingdom has this happened before. It's happened in other places. So I think the need for us to take close attention to this is met by Amendment 206.
I agree entirely with the point that Stephen Kerr is making. I think in response, what I would say is that in terms of the 5-year review, I think there is a balance to be struck about what's the time frame within which you can gather sufficient data to make informed decisions about the way in which the Act is operating. Is it performing as intended? Who are those that are accessing it, for what reasons, etc.? What's the experience of medical professionals that are engaged with the process? And there's always going to be a balance. I recognise that, but alongside that, there is also the requirement for annual reporting of data as well. And that data, as I said earlier, is data that future health committees can look at on an annual basis, take evidence on as required. But for a full-scale review of how the Act is operating in practice, I think it's problematic to set that in a 2-year time horizon, not least because of what we know is the case in other jurisdictions with the implementation of legislation of this type, that the numbers who are accessing it in those early years is relatively small, and it takes a number of years for those numbers to increase and then even out. So I think there is always a balance upon when you were to carry this out, but I would have concerns that doing it at 2 years would then leave a data set from which I think some erroneous conclusions could be drawn about the way that the Act is operating in practice. And as I say, as it sits alongside the annual reporting requirements, I think that provides a sufficient safeguard to address those concerns, and certainly
I'm grateful to you for your response to my intervention there, but I think actually you make the case for a 2-year review at the outset of the bill, simply because of what you outline as an expectation may or may not be met in terms of the numbers of people who will ask to have this procedure. I would say that those initial phases and those initial experiences, both patients and doctors and every other individual and organisation that's impacted by them, that the need for close inspection, a careful, proper review is that much greater. Otherwise, there is a real danger that the way that this law is enacted will spiral in a direction that I genuinely think, not trying to read your mind or your heart on these matters, Liam MacArthur, but that I don't think you would anticipate. And therefore, having this check and balance built in by way of a 2-year review would satisfy that.
Yeah, I understand the rationale, and I can even understand the rationale for setting 2 years, but I would go back to the point that the 5-year review of how the Act is operating sits alongside a requirement for the annual reporting of figures in relation to the numbers accessing it, that government will have oversight of, Public Health Scotland will have oversight of, and the future committees of this Parliament will have oversight of. We've also had the evidence at stage 1 from Crown Office of the interest they will take on each and every instance of an assisted death, certainly in that first 5 years. I think the regulatory bodies, the professional bodies themselves, will take their own interest in what is happening, how it is happening, and therefore I don't think it is solely reliant on this review. I think the need for a wholesale review of how the Act is operating in practice is required, but I think there is a balance to be struck, as I say, about when you hold that such that you have sufficient data to make informed assessments of what is happening, but you do not leave it too long, that the public need to have confidence that a weather eye that is being kept on a process that I fully accept is a new one.
Okay.
Yeah. Sorry, Mr. King. So the view is informed by the experience in other jurisdictions as well. I think 2 years would be too short for the first review, and a recurring review every 2 years thereafter would be excessive, particularly given the bill's requirement for annual reporting data, as I said. A perpetual state of review I don't think is in anyone's interest. With regard to Brian Whittle's Amendment 202, I can see that such a requirement could pose a number of difficulties. We would carry out such a review on the basis of what information and from whom. I know Brian Whittle has been rightly concerned to ensure input from and the confidence of medical professionals. I do worry that this amendment may work against the latter. And on Stephen Kerr's Amendment 130, I've already set out the purpose and scope of the provision in my bill requiring a 5-year review of the operation of the Act. I'd also refer members to my earlier comments in relation to Amendment 57. Murdo Fraser's Amendment 203 appears consequential to Amendment 189, which has already been debated, and again I refer members to my earlier comments. On Stephen Kerr's Amendments 131 and 132, I'd observe that the bill does not prevent the Scottish Government from consulting any organisations or individuals it considers relevant in undertaking the 5-year review, and I would expect it to do so. As such, I don't believe these amendments are necessary. With regard to Daniel Johnson's Amendment 1415, 271 and 272, I'm wary of adding a sunset clause to the bill. This could impact both on the engagement of health professionals and the views of some wishing to request assistance to end their own lives. For example, people may feel they need to make a more hurried decision based on a belief that assisted dying may only be available for a time-limited period. Evidence from other jurisdictions, such as California, has indicated that sunset provisions in assisted dying legislation are not helpful and end up being further amended or indeed removed, as has been the case in California this year. Sunset clauses are not a feature of our legislative process except in very limited circumstances. Often these relate to issues that are felt to be time limited and over a short period. That's demonstrably not the case in this instance. It's imperative, I believe, that this legislation be subject to detailed review and have provided for this after 5 years. This is in addition to annual reporting as well as any additional scrutiny Parliament wishes to undertake. I note Mr Johnson's amendments offer a range of timeframes for such a sunset clause, i.e. 5, 10 and 15 years. Certainly the first of these would be far too soon, but as I say, even the longer time periods appear problematic for a mechanism so far confined, as the Scottish Government observe, to matters affecting Parliament as an institution, such as MSP pensions and lobbying. I understand the rationale and accept that such provisions have been a feature of similar legislation elsewhere, but would be interested in the views of committee colleagues on the principle of this. For much the same reasons, I don't support Stephen Kerr's Amendment 218, which includes a 3-year sunset provision and may also conflict with the rolling review envisaged in Mr Kerr's earlier amendments. On Michael Mara's amendments 260, 280, 282 and 286, I note the Scottish Government view that from a delivery standpoint, the timing of the review could be challenging. Should the bill pass, there would need to be a substantial implementation period in consultation with relevant stakeholders to develop the policy framework for the bill, during which the Scottish Government would undertake its own assessment of the financial impact of the bill. The review proposed by Mr Mara, therefore, could result in duplication and would be curtailed by decisions needing to be made on implementation. It's also out of step with the approach to any other piece of legislation, as far as I can tell, and would have significant financial implications. With regard to Paul Sweeney's amendment, very briefly, yes.
Garth has now been speaking for 26 minutes, so he needs to come to a conclusion.
Yep.
Does the member accept that there are significant variabilities in terms of the cost outlined in the financial memorandum, and that would depend largely on whether it was in the NHS or out the NHS, and both situations would have a significant cost attached, which is why it would be useful to assess it ahead of time?
Well, I had a lengthy exchange with the finance committee on this issue. I think my financial memorandum, to my understanding of course, I know the government have taken a different view. It's for them to explain the rationale for that view. And with regard to Paul Sweeney's Amendment 269, this appears to relate to Amendments 245 and 275 and the issue of complications, which we debated in the previous session. While those amendments were not agreed to, others were, and if there is more I can do ahead of stage 3 on this particular issue, then I'm happy to work with Mr Sweeney on that. Finally, Pam Duncan-Glancy's Amendment 287 seeks to delay the commencement of the Act until legislation is introduced to remove charges for non-residential social care for terminally ill adults requesting assisted dying. I note and echo the Scottish Government's concern that from a legal standpoint it's unusual to prevent provisions of any bill other than provisions that come into force the day after royal assent being brought into force until some other action has been carried out. I don't believe that would be appropriate in this instance, and with that I bring my remarks to a close. Thanks.
Thank you. Jackie Bailey to wind up and press or withdraw Amendment 54.
Thank you, Convener, and my apologies for being slightly late because I missed Liam MacArthur saying he supported Amendment 54, but somebody told me. But unfortunately not Amendment 55. And I fail to understand why, given that I think it's important, should this bill pass, that it fits into the landscape of palliative and end-of-life care. And all that Amendment 55 is seeking to do is creating a code of practice to ensure that assisted dying interacts appropriately with hospices and other providers of palliative and end-of-life care. All of my amendments, Convener, come from Hospice UK. They've taken a neutral position on the bill, but feel that sufficient safeguards are required for the smooth operation of the bill should it pass. I would therefore suggest that we should listen to the views of key stakeholders in this regard. I think we all recognise this is a very significant piece of legislation. The Scottish Government hasn't yet fully engaged in the legislative process. I understand why it's a Members' Bill, but I think it's safe to say that this is probably the most significant Members' Bill that we have ever considered in the Parliament at this stage. I know Patrick and Margaret MacDonald brought forward bills before, but this is the furthest I think it's ever got. So it's really significant, and therefore I hope they engage soon. That said, I think it's important to be sure that the bill works effectively and at the very least does no harm. And therefore scrutiny and monitoring will be essential to make sure that we've got this right. So I would urge committee members to support amendments that advance reviews and assessment to assure people as to the suitability of the bill. And I therefore press Amendment 54. Thank you, Convener.
Thank you, Ms Bailey. The question is that Amendment 54 be agreed to. Are we all agreed? Yes. I call Amendment 55 in the name of Jackie Bailey, already debated with Amendment 54. Jackie Bailey, to move or not move?
Moved.
The question is that Amendment 55 be agreed to. Are we all agreed? Yes. That yes? I call Amendment 71 in the name of Jackie Bailey, already debated with Amendment 65. Jackie Bailey, to move or not move?
Moved.
I call Amendment 71A in the name of Jackie Bailey, already debated with Amendment 65. Jackie Bailey, to move or not move?
Moved.
The question is that Amendment 71A be agreed to. Are we all agreed? No. Committee is not agreed, and we will go to a vote. Those in favour of Amendment 71A? Those against? Abstentions? The result of the vote on Amendment 71A is 3 for, 7 against. There were no abstentions. Therefore, the amendment is not agreed. The question is that Amendment 71 be agreed to. Are we all agreed? Committee is not agreed, and we shall go to a vote. Those in favour of Amendment 71? Those against? Abstentions? The result of the vote on Amendment 71 is 3 for, 7 against. There were no abstentions. The amendment is therefore not agreed. I call Amendment 80 in the name of Jackie Bailey, already debated with Amendment 151. Jackie Bailey, to move or not move?
Moved.
The question is that Amendment 80 be agreed to. Are we all agreed? Committee is not agreed. There will be a vote. Those in favour of Amendment 80? Those against? Abstentions? The result of the vote on Amendment 80 is 3 for, 6 against. There was 1 abstention. The amendment is therefore not agreed. Call Amendment 81 in the name of Jackie Bailey, already debated with Amendment 151. Jackie Bailey, to move or not move?
Moved.
The question is that Amendment 81 be agreed to. Are we all agreed? Committee is not agreed. Those in favour of Amendment 81? Those against? Abstentions? The result of the vote on Amendment 81 is 3 for, 6 against. There was 1 abstention and therefore the amendment is not agreed. I call Amendment 128 in the name of Bob Doris, already debated with Amendment 148. Emma Harper, to move or not move in the name of the amendment in the name of Bob Doris?
Moving on behalf of Bob Doris.
The question is that Amendment 128 be agreed to. Are we all agreed? Committee is not agreed. Those in favour of Amendment 128? Those against? Abstentions? The result of the vote on Amendment 128 is 3 for, 7 against. There were no abstentions. The amendment is therefore not agreed. Call Amendment 196 in the name of Brian Whittle, already debated with Amendment 65. Brian Whittle, to move or not move?
Move, please, Convener.
The question is that Amendment 196 be agreed to. Are we all agreed? No. The committee is not agreed. Those in favour of Amendment 196? Those against? Abstentions? The result of the vote on Amendment 196 is 4 members for, 5 against. There was 1 abstention. Therefore, the amendment is not agreed. I call Amendment 197 in the name of Miles Briggs, grouped with amendments as shown in the groupings. Miles Briggs, to move Amendment 197 and speak to all amendments in the group.
Thank you very much, Convener. Good morning to fellow members. And my apologies, because I think I have the majority of the amendments in this group for the time I might take to talk through them. Amendments 197 and 212 are in relation to provisions of information and guidance. And these proposals are amendments which I've taken forward on behalf of BMA Scotland and RCGP Scotland. These amendments require the establishment of an independent information service to provide information and support to people who may be eligible for assisted dying and for those who wish to pursue this option to help navigate the process. The service this amendment looks to establish is one that would provide factual information about the full range of options available to patients, helping them to make informed decisions, ensure that doctors who did wish or did not feel confident to provide information to patients about assisted dying had somewhere they could direct patients to in the knowledge that they would receive accurate and objective information, and ensure that patients who may meet eligibility criteria would be able to access the information they need without the requirement to go through their doctor, and would have support to navigate that process. In its report, Assisted Dying in Practice, International Experiences and Implications for Health and Social Care, the Nuffield Trust, which looked at the implications of assisted dying legislation in 15 jurisdictions, recommended that policymakers consider other countries' examples around establishing dedicated care navigator roles to provide information on assisted dying, and how service and information can be not only access, but how you connect people with eligible clinicians and offer the support to families, carers and health professionals. And they concluded that there's evidence that these improve access and understanding. I appreciate the Amendment 44 in Liam MacArthur's name, but I don't think this goes far enough and doesn't focus on although it does focus on the provision of information, not on the aspect of support, which I would also like to see. And it's not clear whether or not this would cover personalised information for patients, or whether it could also take the form of generic leaflets setting out information for eligibility to access assisted dying. Now, I do welcome the amendments which were passed in Ross Greer's name in relation to advocacy services and also care navigation services. I think these are really important and almost kind of supersede some of what I'm trying to create as well. But these amendments are important, and especially for clarification for healthcare professionals. Yes. Yeah.
I'm grateful. I'm just keen to understand a little more clearly what the member has in his mind about how he envisages an independent information service working. Does he anticipate that this would be something that operates within the NHS, something that the Scottish Government would fund through the voluntary sector? Can Miles Briggs tell us a little bit more about how he envisages this working? And in particular, whether he's considered, could such an independent service come under pressure in terms of contested views about what impartial or neutral information consists of?
So I think this would have to sit within the NHS, and for the information which we want to make sure, given the nature of our health service, how it's structured with the different health boards, that is a Scotland-wide set of information provided. Earlier amendments which I brought forward in terms of referral pathways, I think that's then important, that someone who requests of a clinician that information, if that clinician then wants to say, well, I can refer you to that service, that is a national service with information which is shared. So guidance around that, I think, should be developed in partnership with those representative bodies. That's why both BMA Scotland and RCGP Scotland have asked me to bring forward these amendments, which I hope clarifies where that information would be a national resource. And I think that's important to make sure we have that clarity and there isn't that variation in any way. My amendments 261, 262, 264, 265 and 266 I brought forward on behalf of RCN Scotland. RCN Scotland maintains a neutral position on assisted dying, but these amendments address two separate concerns which they currently have in relation to the bill. Firstly, the bill outlines several distinct roles involved in the provision of assisted dying, but remains largely silent on where legal and professional accountability lies. Care of an individual and responsibility for the approved substance can be transferred between these roles on a number of occasions. In particular, the bill is silent on the legal effects of a coordinating doctor appointing an authorised health professional. And so these amendments ask three key questions. Should this be seen as a delegation of a task to that authorised health professional? What responsibilities does the coordinating doctor retain at that point? And does it make any reference whether the authorised health professional is a doctor or registered nurse to their respective responsibilities? These are the types of issues that RCN Scotland members must be clear about if they're to have confidence in being able to be involved in the provision of assisted dying. RCN Scotland is of the view that outlining legal accountability on the face of the bill would be challenging, and Amendments 261, 262 and 264 propose that, alternatively, the bill should require Scottish ministers to publish statutory guidance which clearly outlines where legal and professional accountability lies at each step of the assisted dying process. Given the subject matter, this guidance should have the input, I believe, of the Lord Advocate, as outlined in Amendment 266. And in developing this guidance, consultation, I believe, is important with relevant trade unions and professional bodies should be required, which is covered in my Amendment 265. My Amendment 264 also requires Scottish ministers to set out guidance how assisted dying services should be arranged by health boards, including, as discussed earlier, the development of patient pathways. The committee has already considered amendments setting out a standalone assisted dying service, and RCN Scotland has proposed this requirement as they do share the concern expressed by others that adding assisted dying to the workload of existing under-resourced teams would not be sustainable. So I, alongside RCN Scotland, believe these amendments will introduce essential legal clarity to the bill for health professionals involved in each stage of service delivery, and ensure that, if passed, assisted dying can be delivered safely and sustainably across Scotland. And I move these sets of amendments in my name. Thank you.
Ross Greer to speak to Amendment 263 and other amendments in the group.
Thank you, Convener, and I should start off by thanking the committee for their forbearance last week, and in particular thank Patrick Harvey for reading out my script last week when I was literally unable to talk, which is a bit of an inhibitor in the role that we've all chosen. My amendments in this group are intended in part to mitigate what I see as the potential risks of the system being dispersed rather than specialist. If the bill passes, we're going to expect a lot of non-specialist clinicians, particularly GPs, I think we would all recognise are under huge pressure as it stands. And in particular, we're going to expect them to make what are really difficult non-clinical judgments about issues like potential coercion. Now, clinicians do already make non-clinical judgments, GPs in particular do, as part of their wider duty of care towards their patients. But when it concerns the potential choice to end one's own life, the stakes are clearly extremely high. So my earlier amendments that Miles Briggs has referenced on independent advocacy alongside those that he's proposed, I think would go some way to addressing that and providing a safeguard there. But I think it is also important that we set minimum standards for those who are providing this service, both for clinical and non-clinical staff. And I should say I support Miles Briggs' amendments 261 and 262 in particular, that change may to must in regards to the guidance. And I believe that my 263 and 267 build on those. So Amendment 263 would effectively set mandatory minimum standards to which people must be trained in order to carry out functions under the Act, as well as setting up a system to ensure that such functions are being carried out to the required high quality. I think this would go some way to addressing the concern expressed by the BMA and others about the proposed dispersed service model rather than a specialist one, because it would effectively require those wishing to provide the service to opt in by meeting certain standards or undergoing certain training. I think this is really the kind of service that we should only want provided by those who absolutely know what they're doing. And why wouldn't we set some minimum standards for something this significant? The intention of Amendment 267 is to ensure that professionals who are less directly involved in the provision of assisted dying must also comply with minimum standards as would be set out in the guidance. This reflects concerns that have been raised, certainly with me and I know with others, by stakeholders and experts on the importance that people like GP receptionists and carers play in a person's experience of requesting and being provided with assistance. Clearly, the training required of a receptionist would be quite different and altogether much lighter than that required of the GP. But if the goal is to ensure that the whole setting is as safe as possible for the patient, everyone in that space, I think, has a role to play. And training for non-clinical staff, training for all staff in any workplace is perfectly normal. Now, in some cases, it's going to be things as simple as just ensuring that staff don't make comments to patients which could make them feel like a burden. So, like expressing concern about the impact that their condition must be having on their family. But for clinical staff, I would envisage that training and guidance going into much greater detail on matters like spotting potential coercion. It wouldn't be appropriate to specify the details of the training and guidance on the face of the bill, but I think we should ensure that material is produced and that it applies to everyone with a role to play in the service. And that's why I was just about to close, but I'd be happy to.
Thank you, Mr Greer, for taking intervention. I've been contacted by a GP who's a bit concerned. You've spoken about the expertise that's needed and the training that's required. Our GP appointments are quite short, 10, 15 minutes on many occasions. So how can you foresee a GP being able to address some of the issues that you've outlined in that sort of time and constraint that they have?
I mean, I don't think that this is the kind of decision. I certainly don't think it would be Liam MacArthur's intention that these decisions would be taken purely in the space of a 10-minute appointment, and this would be an iterative process that would require a lot of engagement. And that's why I'm concerned that we are asking an awful lot of GPs here. It's a profession under a huge amount of pressure, massive demands on their time. But it's also a profession where you need to be a master of all things. People will come to you with all sorts of issues. People will come to you in the same appointment with multiple issues and with complex social issues going on, not just their health issues, which is why I'm saying that I think we need to, in this case, set out some kind of minimum standards, minimum set of training that should be achieved in the first instance, but also that ongoing quality assurance, so that alongside the issues of capacity that I think Sue Webber's perfectly right to raise, that there is the required expertise and knowledge there, and again, that it's not just the GP, but everybody involved in the setting, much as the training requirements would be quite different for the GP versus the receptionist, that everybody has some level of awareness and understanding of what would be required to make the setting as safe as possible for those who are potentially considering that option. But I'll be happy to close there, Convener.
Thank you, Mr Greer. Liam MacArthur to speak to Amendment 44 and other amendments in the group.
Thanks, Convener. Can I thank both Ross Greer and Miles Briggs for very thoughtfully setting out the thinking behind their amendments. Found myself nodding along to much of what they had to say. I'll maybe turn to their amendments after first addressing my own. 44 and 44A require Scottish ministers to make information available about the lawful provision of assistance to terminally ill adults, health, social care and social work professionals and the wider public in an accessible and understandable format. Section 23 of the bill allows ministers to prepare and publish guidance on the bill and sets out in Section 23(2) particular guidance that may be included. Having given further consideration to this issue during and since Stage 1, I believe this should be strengthened and a standalone requirement for the Scottish Government to ensure all relevant persons, terminally ill adults, medical, social care and social work professionals and the general public have the information they require made available to them. This may, for example, be via a website which provides information as well as a central contact point whereby inquiries can be made and information signposted. This amendment also relates to Amendment 27, requiring a registered medical professional, a practitioner approached by a terminally ill adult wishing to make a first declaration, but who is unable or unwilling to assist, to direct the person to a practitioner who may be able to or are willing to, and the source of relevant information. This amendment ensures such relevant information will be available in an accessible and understandable format and can be easily pointed to by the professional. Turning to the other amendments in the group, first to Miles Briggs' Amendment 197, requiring Scottish ministers to regulate to provide for an independent information service to provide information and support to those who may seek assistance and where requested to support a person in navigating the process. I was interested in the exchanges with Patrick Harbour because I think that's one of the issues I wrestled with. To what extent is it a provision of information, and to what extent is it advice and guidance that may, I think, be more appropriately picked up in the amendments that Ross Greer lodged in the earlier setting around advocacy. Amendment 212 requires the regulations to be subject to the affirmative procedures. I do think that my amendment, combined with the amendments that we've had from Ross Greer, perhaps addresses this sufficiently, but if there are gaps in that provision following on for the votes today, happy to work with Miles Briggs on those. On Jackie Bailey's Amendment 56, and I know she hasn't had a chance to speak to them, but I will offer some thoughts and will respond to what she has to say in due course. I note that Section 23 of the bill allows Scottish ministers to make guidance relevant to the bill's provisions, and in particular allows for guidance to be made about the assessment process, which includes determining that the adult has a terminal illness in line with the definition in Section 2. It's further expected that organisations such as GMC will issue guidance relating to some of the clinical aspects of the bill, such as the terminal illness definition. I hope on that basis Jackie Bailey may feel that the bill already covers the issues she's raised, but she's shaking her head, so that hope has been frustrated. Amendments 261 and 262 in the name of Miles Briggs amend Section 23 so that Scottish ministers must, rather than may, prepare and publish guidance on the Act. Whilst I don't foresee a situation where ministers would not issue guidance where there was a clear need, I have absolutely no objections to these amendments. Amendment 263 in the name of Ross Greer provides that the guidance provided for in Section 23(2) may include provision on training and quality assurance to ensure the effective implementation of the Act. I note that the list provided in Section 23(2) of areas that ministers may bring forward guidance on is not intended to be exhaustive, and that there is nothing to prevent guidance on training and standards to be issued. I also note that if this amendment and those of Miles Briggs were agreed, then such guidance would be required rather than being at ministers' discretion. I also consider that the GMC and other professional bodies will have a role here. All that said, I have no objection to the amendment. Turning to Amendments 264 to 268 and 278, lodged by Miles Briggs, Ross Greer and Paul Sweeney. Amendment 264 provides that the guidance should also set out how the provision of assistance to terminally ill adults in accordance with the Act should be arranged by health boards, including the development of patient pathways and where legal and professional accountability lies in relation to the provision of assistance. Amendment 266 provides that the guidance in 264 relating to legal and professional accountability should be developed in consultation with and approved by the Lord Advocate. I have no objection to the first part of the amendment, but I'm wary around the stipulations on where legal and professional accountability lies. As with other amendments in this group, professional bodies will have a role in providing guidance, and there may be a risk of duplication or confusion. I think something was acknowledged by Miles Briggs in terms of the acceptance by RCN, that there are challenges here, but that's not to say that these can't be addressed. But I thought it was important to flag that with the committee. The bill requires ministers to consult with relevant persons when preparing guidance, and Miles Briggs Amendment 265 adds to this by requiring consultation with relevant trade unions and professional bodies. Again, I'm not opposed to this amendment, but draw attention to the existing requirement to consult such persons as considered appropriate. I can't foresee circumstances in which ministers would not consult such bodies. Section 23(4) provides that a person carrying out a function under the Act must have regard to the guidance. Ross Greer's Amendment 267 adds to this by requiring that a person who is otherwise involved in the process of a terminally ill adult requesting and being provided with assistance must also have regard to guidance. I think it likely the provision as drafted would ensure that everyone involved in the requesting and provision of assistance who would need to follow guidance from ministers would be covered, and the amendment is therefore not essential, but once again I have no strong objection to it. Again, in the same situation with Paul Sweeney's amendments as with Jackie Bailey's. I have yet to hear him speak to them, but I will offer the following thoughts in relation to 268 and 278, which is consequential. Provide for ministers to prepare and publish guidance for coordinated registered medical practitioners and authorised health professionals regarding the provision and assistance under Section 15. Amendment 268 sets out what must be included in the guidance. Ministers must consult persons they consider appropriate, and those carrying out functions in relation to Section 15 must have regard to the guidance. The guidance should include the management of cases where a terminally ill adult has used the substance but has not died within a reasonable time period. The amendment provides that the ministers must set out in regulations what is meant by reasonable period. I do believe the existing guidance provision in the bill, which makes specific reference to the provisions in Section 15 regarding the use of the substance, is sufficient, and have some concern, as I've said in previous groupings, about reference to reasonable period being set out in statute. I appreciate at this point there is a sizable list on the agenda for my further discussions with Paul Sweeney, but at the risk of overloading it, can I maybe add this one to it ahead of stage 3? With that, Convener, can I conclude my remarks offering another thanks to the committee for your painstaking work. I think it's allowed detailed scrutiny and probing of a range of different issues that were raised at stage 1. I know it has been a pretty Herculean task, but I thank you very much for your forbearance, not least in allowing me far more time than probably you felt was necessary. But with that, thank you very much indeed.
Thank you, Mr MacArthur. Jackie Bailey to speak to Amendment 56 and other amendments in the group.
Thank you very much, Convener. And I speak to Amendment 56, which I have tabled on behalf of CHAS, which is the Children's Hospice Association Scotland. And I think we would acknowledge one of the central problems with the bill as drafted and identified in the committee's Stage 1 report is the definition of terminal illness. This is extremely complex to diagnose and assess in the case in particular of young adults. So there is a genuine feeling of a need for further definition referred to on the face of the bill, specifically about young adults, not just adults in general. The bill's definition of terminal illness does not recognise the significant clinical differences between a young person with a life-shortening condition that may meet the bill's definition of terminal illness and an older adult with a terminal prognosis. So the current definition brings into scope young people who potentially have years of stable life left to live, and that goes against the stated intention of the bill that it should be reserved for those at end of life. An example that I would give the committee would be a young person with complex Duchenne muscular dystrophy, where medical advances can delay and ultimately inevitable death for years or even for decades. Other conditions such as spinal muscular... I'm having a problem today. I didn't lose my voice like Ross Greer. I kept going, but sometimes I wonder whether I should have done so. So let me try again. For other conditions, for example, spinal muscular atrophy, treatment options increasingly are becoming available, which may alter prognosis and quality of life to such an extent that the position of the young person in terms of assisted dying would change dramatically. So key terms such as the definition of advanced and progressive don't have accepted standard definitions or interpretations in a clinical context. There are multiple ways to define premature mortality, especially in the context of a young person with a life-shortening condition who by definition is likely to die young. So the amendment is essential if we want to safeguard young people and provide certainty and clarity to medical practitioners about how they must interpret the Act in their clinical assessment of a young person. Finally, Convener, I believe that a guarantee is needed on the face of the bill. Making provision for this guidance on the face of the bill will help to ensure that young people are not at risk of being approved for assisted dying prematurely. Thank you.
Thank you, Jackie Bailey. Paul Sweeney to speak to Amendment 268 and other amendments in the group.
Thank you, Convener. My amendments in this group, 268 and 278, aim to strengthen the practical framework for administering assisted dying safely and responsibly. These amendments would require the Scottish Ministers to publish detailed guidance on what to do if complications were to arise, including what constitutes a reasonable period before death and how to respond to side effects or even failed medication. Without this, clinicians could face serious medical legal risk if problems were to arise during the final stages of the assisted dying process. So together, I believe that these amendments are a reasonable measure to ensure safety and consistency during the most sensitive stage of the assisted dying process.
Thank you, Mr Sweeney. Miles Briggs to wind up and press or withdraw Amendment 197.
Thank you, Convener. And I should have said earlier, I welcome the amendments in Jackie Bailey's name in this group as well. Given what I said earlier in relation to Ross Greer's amendments around advocacy service, I don't intend to press amendments 197, 212, but I do intend to press all the others in this group. So moved.
Thank you, Mr Briggs. So you do not wish to press Amendment 197. Does any member object to Mr Greer not pressing Amendment 197? Mr Briggs, sorry. No member objects. So that amendment is withdrawn. So I call Amendment 198 in the name of Miles Briggs, already debated with Amendment 151. Miles Briggs to move or not move?
Moved.
The question is that Amendment 198 be agreed to. Are we all agreed? Committee is not agreed and we'll move to a vote. Those in favour of Amendment 198? Those against? Abstentions? The result of the vote on Amendment 198 is 4 members voted for, 6 against. There were no abstentions. The amendment is therefore not agreed. I call Amendment 254 in the name of Paul Sweeney, already debated with Amendment 65. Paul Sweeney to move or not move?
Move, Convener.
The question is that Amendment 254 be agreed to. Are we all agreed? No. Committee is not agreed. Those in favour of Amendment 254? Those against? Abstentions? The result of the vote on Amendment 254 is 3 for, 7 against. There were no abstentions. The amendment is therefore not agreed. The question is that Amendment 255 be agreed to. Are we all agreed? Committee is not agreed. Oh, sorry. Paul Sweeney to move or not move Amendment 255. Thank you. The question is that Amendment 255 be agreed to. Are we all agreed? Committee is not agreed. We'll move to a vote. Those in favour of Amendment 255? Those against? Abstentions? The result of the vote on Amendment 255 is 3 for, 7 against. There were no abstentions. The amendment is therefore not agreed. I call Amendment 256 in the name of Fulton McGregor, already debated, with Amendment 148. Emma Harper to move or not move on behalf of Fulton McGregor.
Not moving on behalf of Fulton McGregor.
Call Amendment 257 in the name of Fulton McGregor, already debated, with Amendment 148. Emma Harper to move or not move on behalf of Fulton McGregor.
Not moving, Convener.
I call Amendment 258 in the name of Pam Duncan-Glancy, already debated, with Amendment 54. Pam Duncan-Glancy to move or not move.
Moved, Convener.
The question is that Amendment 258 be agreed to. Are we all agreed? No. Committee is not agreed. We will move to a vote. Those in favour of Amendment 258? Those against? Abstentions? The result of the vote on Amendment 258 is 3 for, 7 against. There was 1 abstention. Oh, 0. All right, it's marked as an abstention on there. So 7 against, and therefore the amendment is not agreed to. I call Amendment 258 in the name of Stuart McMillan, already debated. 259, sorry, in the name of Stuart McMillan, already debated, with Amendment 54. Pam Duncan-Glancy to move or not move on behalf of Stuart McMillan.
On behalf of Stuart McMillan, who's asked me to do this, I'll move the amendment.
The question is that Amendment 259 be agreed to. Are we all agreed? No. The committee is not agreed. Those in favour of the amendment? Those against? Abstentions? The result of the vote on Amendment 259 is 0 for, 10 against. There were no abstentions. The amendment is therefore not agreed. Call Amendment 260 in the name of Michael Mara, already debated, with Amendment 54. Pam Duncan-Glancy to move or not move on behalf of Michael Mara.
Moved, Convener.
The question is that Amendment 260 be agreed to. Are we all agreed? Committee is not agreed. Those in favour of Amendment 260? Those against? Abstentions? The result of the vote on Amendment 260 is 3 for, 7 against. There were no abstentions. The amendment is therefore not agreed. Call Amendment 261 in the name of Miles Briggs, already debated, with Amendment 197. Michael's, I was going to call you Michael there, sorry, Miles Briggs, to move or not move?
Moved, Convener.
The question is that Amendment 261 be agreed. Are we all agreed? Yes, committee is agreed. I call Amendment 262 in the name of Miles Briggs, already debated, with Amendment 197. Miles Briggs, to move or not move?
Moved.
The question is that Amendment 262 be agreed to. Are we all agreed? Committee is agreed. I call Amendment 263 in the name of Ross Greer, already debated, with Amendment 197. Ross Greer, to move or not move?
Moved.
The question is that Amendment 263 be agreed to. Are we all agreed?
Yes.
Committee is agreed. I call Amendment 264 in the name of Miles Briggs, already debated, with Amendment 197. Miles Briggs, to move or not move?
Moved.
The question is that Amendment 264 be agreed to. Are we all agreed? Committee is not agreed. We'll go to a vote. Those in favour of Amendment 264? Those against? Abstentions? The result of the vote on Amendment 264 is 3 for, 7 against. There were no abstentions. Therefore, the amendment is not agreed. Call Amendment 265 in the name of Miles Briggs, already debated, with Amendment 197. Miles Briggs, to move or not move?
Moved.
The question is that Amendment 265 be agreed to. Are we all agreed? No. Yes? No. OK. Committee is not agreed. Those in favour of Amendment 265? Those against? Abstentions? Yeah, sure. So can we run that vote again for the clerks, please? Those in favour of Amendment 265? Those against? Abstentions? The result of the vote on Amendment 265 is 4, 7 against 2. There is 1 abstention. Therefore, the amendment is agreed. Call Amendment 266 in the name of Miles Briggs, already debated, with Amendment 197. Miles Briggs, to move or not move?
Moved.
The question is that Amendment 266 be agreed to. Are we all agreed? Committee is not agreed. Those in favour of Amendment 266? Those against? Abstentions? The result of the vote on Amendment 266 is 6 for, 2 against. There were 2 abstentions. Therefore, the amendment is agreed. Call Amendment 267 in the name of Ross Greer, already debated, with Amendment 197. Ross Greer, to move or not move?
Move.
The question is that Amendment 267 be agreed to. Are we all agreed? Committee is not agreed. We'll move to a vote. Those in favour of Amendment 267? Those against? Abstentions? The result of the vote on Amendment 267 is 4 for, 5 against. There was 1 abstention. Therefore, the amendment is not agreed. The question is that Section 23 be agreed. Are we all agreed? Committee's agreed. Call Amendment 44 in the name of Liam MacArthur, already debated, with Amendment 197. Liam MacArthur, to move or not move?
Move.
Call Amendment 44A in the name of Liam MacArthur, already debated, with Amendment 197. Liam MacArthur, to move or not move?
Also move, Convener.
The question is that Amendment 44A be agreed to. Are we all agreed? Yes. Committee's not agreed. Those in favour of Amendment 44A? Those against? Abstentions? The result of the vote on Amendment 44A is 8 for, 2 against. There were no abstentions. Therefore, the amendment is agreed. Liam MacArthur, to press or withdraw Amendment 44 as amended.
Pressed.
The question is that Amendment 44 as amended be agreed to. Are we all agreed? Committee is not agreed. Those in favour of Amendment 44 as amended? Those against? Abstentions? The result of the vote on Amendment 44 as amended was 8 for, 2 against, and there were no abstentions. The amendment as amended is therefore agreed. Call Amendment 56 in the name of Jackie Bailey, already debated, with Amendment 197. Jackie Bailey, to move or not move?
Moved.
The question is that Amendment 56 be agreed to. Are we all agreed? Committee is not agreed. Those in favour of Amendment 56? Those against? Abstentions? The result of the vote on Amendment 56 is 4 for, 4 against. There were 2 abstentions. As the vote is tied, I will use my casting vote as convener and vote for the amendment. Sorry, vote against the amendment. I have to be consistent in my voting, Miss Bailey. I call Amendment 268 in the name of Paul Sweeney, already debated, with Amendment 197. Paul Sweeney, to move or not move?
Move, Convener.
The question is that Amendment 268 be agreed to. Are we all agreed? Committee is not agreed. Those in favour of Amendment 268? Those against? Abstentions? The result of the vote on Amendment 268 is 4 for, 6 against. There were no abstentions. The amendment is therefore not agreed. Call Amendment 21 in the name of Miles Briggs, already debated with Amendment 54. Miles Briggs, to move or not move?
Moved.
The question is that Amendment 21 be agreed to. Are we all agreed? Committee is not agreed. Those in favour of Amendment 21? Those against? Abstentions? The result of the vote on Amendment 21 is 3 for, 7 against. There were no abstentions. Therefore, the amendment is not agreed. Call Amendment 269 in the name of Paul Sweeney, already debated with Amendment 54. Paul Sweeney, to move or not move?
Move, Convener.
The question is that Amendment 269 be agreed to. Are we all agreed? Yes. Committee is not agreed. Those in favour of Amendment 269? Those against? Abstentions? The result of the vote on Amendment 269 is 4 for, 6 against. There were no abstentions. Therefore, the amendment is not agreed. I call Amendment 22 in the name of Miles Briggs, already debated with Amendment 54. Miles Briggs, to move or not move?
Moved.
The question is that Amendment 22 be agreed to. Are we all agreed? Committee is not agreed. Those in favour of Amendment 22? Those against? Abstentions? The result of the vote on Amendment 22 is 3 for, 7 against. There were no abstentions. Therefore, the amendment is not agreed. The question is that Section 24 be agreed to. Are we all agreed? Yes. The question is that Section 25 be agreed to. Are we all agreed? Yes. I call Amendment 18 in the name of Daniel Johnson, already debated with Amendment 54. Paul Sweeney, to move or not move on behalf of Daniel Johnson?
I'll move, Convener.
The question is that Amendment 18 be agreed to. Are we all agreed? No. Committee is not agreed. There be a vote. Those in favour of Amendment 18? Those against? Abstentions? The result of the vote on Amendment 18, 1 for, 6 against, and there were 3 abstentions. The amendment is therefore not agreed. Call Amendment 199 in the name of Murdo Fraser, already debated with Amendment 54. Sue Webber to move on behalf of Murdo Fraser or not move?
On behalf of Murdo Fraser, moved, Convener.
Thank you. The question is that Amendment 199 be agreed to. Are we all agreed? Committee's not agreed. Those in favour of Amendment 199? Those against? Abstentions? Thank you. Bless you. The result of the vote on Amendment 199 is 2 for, 8 against. There were no abstentions, therefore the amendment is not agreed. Call Amendment 200 in the name of Miles Briggs, already debated with Amendment 189. Miles Briggs to move or not move?
Moved.
The question is that Amendment 200 be agreed to. Are we all agreed? Committee's not agreed. Those in favour of Amendment 200? Those against? Abstentions? The result of the vote on Amendment 200 is 0 for, 8 against. There were 2 abstentions, therefore the amendment is not agreed. I call on Amendment 270 in the name of Pam Duncan-Glancy, already debated with Amendment 65. Pam Duncan-Glancy to move or not move?
Move.
The question is that Amendment 270 be agreed to. Are we all agreed? Committee's not agreed. Those in favour of Amendment 270? Those against? Abstentions? The result of the vote on Amendment 270 is 2 for, 8 against. There were no abstentions. The amendment is therefore not agreed. I call Amendment 19 in the name of Daniel Johnson, already debated with Amendment 54. Pam Duncan-Glancy. Oh, sorry. Apologies. Paul Sweeney to move or not move on behalf of Daniel Johnson.
I move on Mr Johnson's behalf.
Thank you. The question is that Amendment 19 be agreed to. Are we all agreed? No. Committee's not agreed. Those in favour of Amendment 19? Those against? Abstentions? The result of the vote on Amendment 19 is there's 1 for, 9 against. There were no abstentions. The amendment is therefore not agreed. I call Amendment 129 in the name of Stephen Kerr, already debated with Amendment 54. Stephen Kerr to move or not move?
Moved.
The question is that Amendment 129 be agreed. Are we all agreed? No. Committee's not agreed. Those in favour of Amendment 129? Those against? Abstentions? The result of the vote on Amendment 129 is 2 for, 7 against. There was 1 abstention. The amendment is therefore not agreed. I call Amendment 201. The question is that Section 26 be agreed to. Are we all agreed? I call Amendment 201 in the name of Stephen Kerr, already debated, with Amendment 54. Stephen Kerr, to move or not move?
Moved.
The question is that Amendment 201 be agreed to. Are we all agreed? No. Committee is not agreed. Those in favour of Amendment 201? Those against? Abstentions? The result of the vote on Amendment 201 is 2 for, 7 against. There was 1 abstention, therefore the amendment is not agreed. I call Amendment 57 in the name of Jackie Bailey, already debated with Amendment 54. Jackie Bailey, to move or not move?
Moved.
The question is that Amendment 57 be agreed to. Are we all agreed? No. Committee's not agreed. Those in favour of Amendment 57? Those against? Abstentions? The result of the vote on Amendment 57 is 3 for, 7 against. There were no abstentions, therefore the amendment is not agreed. I call Amendment 202 in the name of Brian Whittle, already debated with Amendment 54. Brian Whittle, to move or not move?
Move, please, Convener.
The question is that Amendment 202 be agreed to. Are we all agreed? No. Committee's not agreed. Those in favour of Amendment 202? Those against? Abstentions? The result of the vote on Amendment 202 is 3 for, 7 against. There were no abstentions. The amendment is therefore not agreed. Call Amendment 23 in the name of Miles Briggs, already debated with Amendment 54. Miles Briggs, to move or not move?
Moved.
The question is that Amendment 23 be agreed to. Are we all agreed? Committee's not agreed. Those in favour of Amendment 23? Those against? Abstentions? The result of the vote on Amendment 23 is 3 for, 7 against. There were no abstentions. The amendment is therefore not agreed. I call Amendment 130 in the name of Stephen Kerr, already debated with Amendment 54. Stephen Kerr, to move or not move?
Moved.
The question is that Amendment 130 be agreed to. Are we all agreed?
No.
Committee's not agreed. Those in favour of Amendment 130? Those against? Abstentions? The result of the vote on Amendment 130 is 2 for, 8 against. There were no abstentions. Therefore, the amendment is not agreed. I call Amendment 203 in the name of Murdo Fraser, already debated with Amendment 54. Sue Webber, to move or not move in Murdo Fraser's name?
Moved, Convener.
The question is that Amendment 203 be agreed to. Are we all agreed? Committee is not agreed. Those in favour of Amendment 203? Those against? Abstentions? The result of the vote on Amendment 203 is 1 for, 8 against. There was 1 abstention and the amendment is therefore not agreed. I call Amendment 204 in the name of Stephen Kerr, already debated with Amendment 54. Stephen Kerr, to move or not move?
Moved.
The question is that Amendment 204 be agreed to. Are we all agreed? No. Committee is not agreed. Those in favour of Amendment 204? Those against? Abstentions? The result of the vote on Amendment 204 is 2 for, 8 against. There were no abstentions and the amendment is therefore not agreed. I call Amendment 131 in the name of Stephen Kerr, already debated with Amendment 54. Stephen Kerr, to move or not move?
Moved.
The question is that Amendment 131 be agreed to. Are we all agreed? No. Committee is not agreed. We'll move to a vote. Those in favour of Amendment 131? Those against? Abstentions? Thank you. The result of the vote on Amendment 131 is 2 for, 8 against. There were no abstentions. Therefore, the amendment is not agreed. I call Amendment 132 in the name of Stephen Kerr, already debated with Amendment 54. Stephen Kerr, to move or not move?
Moved.
The question is that Amendment 132 be agreed to. Are we all agreed? Committee is not agreed. Those in favour of Amendment 132? Those against? Abstentions? The result of the vote on Amendment 132 is 2 for, 8 against. There were no abstentions. Therefore, the amendment is not agreed. I call Amendment 205 in the name of Stephen Kerr, already debated with Amendment 54. Stephen Kerr, to move or not move?
Moved.
The question is that Amendment 205 be agreed to. Are we all agreed? No. Committee is not agreed. Those in favour of Amendment 205? Those against? Abstentions? The result of the vote on Amendment 205 is 1 for, 8 against. There was 1 abstention. Therefore, the amendment is not agreed. Call Amendment 206 in the name of Stephen Kerr, already debated with Amendment 54. Stephen Kerr, to move or not move?
Moved.
The question is that Amendment 206 be agreed to. Are we all agreed? No. Committee's not agreed. Those in favour of Amendment 206? Those against? Abstentions? The result of the vote on Amendment 206 is 1 for, 8 against. There was 1 abstention. Therefore, the amendment is not agreed. The question is that Section 27 be agreed to. Are we all agreed? Yes. Call Amendment 271 in the name of Daniel Johnson, already debated with Amendment 54. Paul Sweeney to move or not move on behalf of Daniel Johnson.
Move, Convener.
The question is that Amendment 271 be agreed to. Are we all agreed?
Yes.
Committee's not agreed. Those in favour of Amendment 271? Those against? Abstentions? The result of the vote on Amendment 271 is 1 for, 7 against. There were 2 abstentions. The amendment is therefore not agreed. I call Amendment 272 in the name of Daniel Johnson, already debated with Amendment 54. Paul Sweeney to move or not move on behalf of Daniel Johnson.
Move, Convener.
The question is that Amendment 272 be agreed to. Are we all agreed? Yes. Those in favour of Amendment 272? Those against? Abstentions? The result of the vote on Amendment 272 is 4 for, 6 against. There was no abstentions. Therefore, the amendment is not agreed. I call Amendment 14 in the name of Daniel Johnson, already debated with Amendment 54. Paul Sweeney to move or not move on behalf of Daniel Johnson.
Move, Convener.
The question is that Amendment 14 be agreed to. Are we all agreed? Yes. Committee is not agreed. Those in favour of Amendment 14? Those against? Abstentions? The result of the vote on Amendment 14 is 1 for, 7 against. There were 2 abstentions. Therefore, the amendment is not agreed. I call Amendment 58 in the name of Jackie Bailey, already debated with Amendment 229. Jackie Bailey to move or not move?
Moved.
The question is that Amendment 58 be agreed to. Are we all agreed? Committee's not agreed and we'll move to a vote. Those in favour of Amendment 58? Those against? Abstentions? The result of the vote on Amendment 58 is 3 for, 7 against. There were no abstentions. Therefore, the amendment is not agreed. I call Amendment 45 in the name of Liam MacArthur, already debated, with Amendment 149. Liam MacArthur, to move or not move?
Moved, Convener.
The question is that Amendment 45 be agreed to. Are we all agreed? No. Committee is not agreed. We'll move to a vote. Those in favour of Amendment 45? Those against? Abstentions? The result of the vote on Amendment 45 is 8 for, 2 against. There were no abstentions and the amendment is therefore agreed. And I call Amendment 46 in the name of Liam MacArthur, already debated, with Amendment 65. Liam MacArthur, to move or not move?
Move.
I call Amendment 46A in the name of Liam MacArthur, already debated, with Amendment 65. Liam MacArthur, to move or not move?
Moved.
The question is that Amendment 46A be agreed to. Are we all agreed? Yes. Yes, committee's agreed. Liam MacArthur, to press or withdraw Amendment 65 as amended. 46 as amended.
Pressed, Convener.
The question is that Amendment 46 as amended be agreed to. Are we all agreed? Yes. Yes. Call Amendment 207 in the name of Brian Whittle, already debated, with Amendment 83. Brian Whittle, to move or not move?
Move, please, Convener.
The question is that Amendment 207 be agreed to. Are we all agreed? Committee is not agreed and will therefore move to a vote. Those in favour of Amendment 207? Those against? Abstentions? The result of the vote on Amendment 207 is 3 for, 7 against. There were no abstentions and therefore the amendment is not agreed. It's clear from the amount of amendments that we still have to vote on that a committee is going to have to sit this evening. Therefore, I'm going to suspend this meeting and the committee will reconvene to continue Stage 2 proceedings on the assisted dying for terminally ill adults Scotland Bill at 6 p.m. this evening.